All right, we'll call this July 16th, 2019 meeting to order at 6:06 PM. Citizens participation. Actually, excuse me, Mark, I have to, my procedural things, right? I have to read a couple of things, sorry. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. And you're not recording the meeting, right, Laura? And Mark, you're not recording the meeting? No. Okay. We are,
Yeah,
that's what we're doing.
WACA-TV is recording and presenting.
WACA-TV,
We are being recorded on WACA-TV.
if you're watching us on it.
Yes. Are you all set, Mark?
Okay. I was waiting for, is there anybody in the audience?
You are our audience, Mark.
Summertime audience.
The Nielsen Raider has returned. Long time no see, Board of Health lively. First of all, happy summer. All being all tanned up and healthy and all that. Vitamin D is doing wonders for me. My usual, okay, the first one is, the last time you saw me, about my dad, doing a lot better. A little more better mobile, a little more better healthy, a little more better dehydrated and going well. He's kicking my butt now. He's saying, caregiver, it's time my foot hit your butt. Okay, I saw the agenda tonight, and usually down the very end, usually have ideas for future items for next meeting and stuff like that. I email a suggestion, because it is summer, about pool safety, recreational state park safety, swimming tips and stuff like that. There's been nothing said yet about what to look out for, how to take things in stride, and what the parents should be with the kids, how safe is all that stuff. Can that be brought up either tonight, since it is July, or can it be brought up before the end of the summer? Anybody?
So we could put something on our website, right?
Sure, in fact, we just updated our website for hurricane information, so we always have put in the paper, people can reference the Department of Public Health website for summer safety, but recently with the changes, we can put it on our website as well.
Okay,
The Department of Public Health does have summer safety tips on various summer issues.
Okay, and
Yeah.
for that other reason, and safety tips and for the warmth, heat, and everything else, there's been a quiet Board of Health for no issues that come through the office yet about anybody's health, anybody's issues, anybody's heat strokes or anything? Nothing been heard? All quiet? Or,
We wouldn't know about it, Mark.
well, the fire department would be hearing things and,
Yeah, I'm not.
okay. I'm just knocking on wood, making sure.
Everybody's safe.
Yep, and working wise, hey, I just do what I do. I'm having fun doing what I do, how I do it, where to go, never say no. It's what I do, always on the go.
Stay hydrated.
Thanks, Mark.
Thank you, Mark.
Diane, with regard to his request for updating the information for general public, could we request town managers to add a line or a link to in his messages that he keeps sending it so it reaches more people?
So people have to subscribe to it, and it's funny.
Yeah, whatever
Well,
it
it's
is, but
funny, no, but
he,
it's funny you mentioned that, because we had, on the daytime hat that I wear, the Board of Selectmen's office reviewed, and it's a good plug for everybody who could be watching, is people need to go on the website and subscribe to each department. Because
Right.
of DPW, so people should subscribe, because they will get a notification that information has been added to our webpage or something has been changed. So if you have enrolled, you might want to also enroll on our page. Make sure you get notified, because they will be notified once we
Should
post
be-
something.
right, but if you can have him add a line
So almost like a
suggesting people to
newsflash.
subscribe and whatever that we have
Yeah,
updated.
again, we
Whatever
talked
you
about-
updated,
Yeah.
we can just line it up there, and instead of giving the details, you can just say, go and look at it, this link.
Yeah.
So we can request
So
him
when
so that
Mark
he.
posts it on the website, it will notify people who are subscribed to our page.
That, plus ask the manager, he puts out a
You
bulletin.
talking about for the news flash, like on the
Yeah,
front page?
he puts in every time a note, so you can add
Yes,
that.
yeah.
So,
Mark can ask, yeah.
yeah, that's a better way to do it. Thank you.
But again, even with that, just so you have to subscribe to it
Sure,
to
sure.
know that the
Yeah,
information's
they have to,
there.
their part. They have
So
to do-
hopefully it's a good
yeah.
plug for everybody to go on and
Even
subscribe
if,
to our webpage.
even
and
if they open the link, they have to read it all, so
Yep.
they have to do their part too.
Absolutely. Turn it over to you, Chris,
Okay,
for the next subject, which is review proposed regulations, tobacco regulations.
okay, so I spent some time going back and looking at 7 of our sister towns. Well, most of them are neighboring towns. Some of them are the towns that, with us, pioneered new tobacco regulations. The 7 towns are Framingham, Holliston, Hopkinton, Natick, Needham, Somerville, and Southborough. And with regard to smoke accessories, which is the hot point that we were talking about, Framingham is currently the only town that is, has any wording or verbiage regarding smoke accessories. And what they've actually done is, they've not only defined what smoke accessories are, they've created a separate permit for selling smoke accessories and have a separate regulation for it. So, one of the things we need to consider as a board, do we want to look at that? Do we want to, one option we have, right, is we can, I believe, and Mark, tell me if I'm wrong, can we choose to ban smoke accessories? At which point we would define them and say they're not allowed for sale?
I would have to check with legal counsel on a complete ban.
Okay.
Because we couldn't completely ban even flavors. We've
Okay.
allowed that ban to be handled through adult retail stores, so.
So
I
the
would
question
have
is,
to
if
check.
we do want to ban completely smoke accessories, we have to check if we can, and then
Yeah.
the verbiage would be pretty simple. We'd have to define what smoke accessories are and basically say you can't sell them. If that's not the option we wanna take, then we'd probably, because currently anyone can buy them from anywhere, doesn't matter the age, then we'd wanna look at the option of following the Framingham model, defining it, and then deciding, do we want to create a separate permit for it? Seems to make sense, because then we can charge for that permit and redeem some of the costs of monitoring
Managing
it.
it, yeah.
And then make some modifications to, and basically what I would do at that point, if that's the route we would go, is I'd basically take their verbiage, write it in, share it among us, we'd refine it, and then present it. Then we'd present that to the public and vote on it.
Before you move on, what, besides our monitoring that we do at tobacco, what are you referring to for monitoring for the I call it paraphernalia?
Well, yeah, I mean, it would just be a matter of if we say, okay, the law is you can't sell it to anyone over 21, we might have
Sting.
someone, sting operations in the same way, and enforcement as well.
Do we have to, if we're saying the way we're gonna see it, that they don't sell it to have a sting, is there money in an account for those kinds of operations? Or does it have to be factored into your budget if you want it done?
For the stings?
Yeah,
Yeah, we have, yeah. Go ahead, no, go ahead, Mark.
We have a revolving fund that the town meeting approved, and even at this last town meeting for tobacco control programs,
okay,
including what we call comprehensive inspections.
okay.
So
So-
those are all derived out of the fees that we charge.
And
Okay.
that's where, thank you,
So
Paige.
instead of going to the general fund, it goes to this secluded fund that we have access to it.
Well, that's why I was asking, because you can only charge charge a fee that covers a service provided, no more. So that's why I was asking, we
Mhm.
take that into consideration. If there's a permit fee,
Mhm.
it would be, probably wouldn't be as much as our tobacco.
Yeah, we could add, if we're gonna do additional reviews, might it be point of sale reviews or comprehensive inspections, and possibly, now that we may have a new item called smoke accessories facilities, then those fees would be to accommodate the inspection process and review process.
So, oh, sorry.
No, 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 no.
So, just so I'm clear on this, being the new person, so we're talking about having a smoke accessory store only. You can't buy the smoke accessory where you get the stuff to put in the smoke accessory, correct?
That's correct,
Okay.
because that would be a dispensary for marijuana at this point, which is not allowed in Ashland. So what a smoke accessory would be is like a vape shop without any product, but just the accessories to inhale or I don't know about other stuff, but Mostly they're units to inhale, such as pipes, wrapping papers, things like that. And so instead of having it at your local convenience store where anyone can walk in, it would be only allowed in a smoke accessory facility where only adults can go in,
Or,
So,
if you
Go
so
ahead.
wish.
I guess what I'm getting at is, so you're saying things like rolling papers that people do use to make their own cigarettes, that can't afford the cigarettes because they shouldn't be smoking them anyway, I agree with
Yeah.
that, but if it's their choice to smoke and they're rolling their own cigarettes, and they can't get loose tobacco and cigarette rolling papers at the same
would it help
establishment.
if I,
Go
I was
ahead.
gonna say, maybe Framingham resolved that problem.
Did
I-
they?
What,
I can't tell you that, but let me read the definition of smoke accessories as they have it, so that,
Okay.
because that's what, I mean, if we're gonna do it, we may as well follow a model, not
Yeah.
reinvent the wheel.
right, I mean, I could, before you read that, just because, when Sam came here, it was alarming to me. I
Yeah.
didn't realize that somebody under the age of 21, or
Mhm.
whatever age, can go in and buy any of these accessories.
Right,
So they changed it, from what I understand, to be you have to be 21 to buy the accessory.
yeah.
And that's
Yeah.
what, that was my thought
That
originally.
makes sense,
And-
but
and-
now we're talking about putting it in a different store,
And-
so you
Right.
gotta go
and-
two places.
And that's not necessary, I mean, we don't have to do that, right? We can say that current tobacco licensees can apply for a permit to sell smoke accessories, and in order to buy them, you have to be 21 or over.
We could, right,
We-
and we
we
could
can-
say you can't buy tobacco accessories unless you're 21 and over,
Right,
period.
correct. Exactly. yeah.
And then address an adult smoking establishment maybe as just, they
Yep,
could.
they're allowed there
Which
as
is
well.
two different
Yeah.
things.
We don't have to limit that regulation
Uh-huh.
to smoking, to only smoking stores. We can make that regulation apply to anybody. The primary thing is that the primary concern is, at least that,
He's not keeping them tied together, the
Yeah.
smoking material as
Yeah.
with the accessories.
Yeah, we-
They're two independent
Yeah.
items, products that they can sell on their own.
So-
So anybody could sell this, and anybody could sell this, but they must have licenses, permits to sell. And
Understand.
both of them can be at one location or two different locations. Am I?
Well, my thought is,
Correct.
it just, I mean, maybe I'm just thinking simple, is nobody can sell smoking accessories to
Right.
anybody under the age of 21.
Right.
Like,
Correct.
they don't need another
That-
license,
that
they
was-
already have a license to sell the tobacco products.
And
Right,
that,
but they still
the
have to have a
access-
license for this.
Yeah,
but
I-
can it be a
They
license?
could.
Well, I
It
think
would-
once,
covers both?
once Chris reads the definition, I stand corrected on papers,
Thank
papers
you.
aren't noted in
Okay.
here, but I think, sorry, I don't mean to point past you, but
That's
Chris was
okay.
gonna read the definition, papers are not in there, so.
so yeah, smoke accessories, equipment, products, devices, or materials of any kind that are intended or designed for use in ingesting, inhaling, or otherwise introducing tobacco product, marijuana, I'm not gonna say the full name, but THC,
Cannibal.
or CBD into the human body, including but not limited to marijuana accessories, bongs, pipes, glass pipes, vaporizers, vape pens, hookah apparatus, dab rigs, pods, tanks, and cartridges.
So it does include paper.
It does. Absolutely.
Didn't say.
It didn't
It says,
include it.
it says
Yeah, it's
all
included,
products
right,
that do
Right,
not
I
it.
think-
included, but I
Right.
agree
License.
I
that,
think
that
to
that
solve the,
definition
I
would
think to
encompass
solve
that.
the issue with that is
Yeah.
because, again, I mean, they just, you cannot buy the products in Framingham unless you're 21 and older, period.
Yeah.
But, so I don't understand why somebody would have, okay, so maybe somebody wants a smoke accessory store to sell bongs and pipes, and that's great, and they have to get a license, and it's 21 years old only. But we're saying that there are stores right now that you can go in and there's no age, you can, this pipe up on the shelf, you can buy it, and you can be 14. So, can't we just make it as in tobacco, that you have to be 21?
Mhm.
Why would you, if you're already selling them, why would you have to come in and get a license for tobacco and a license for the, I think that's big government, like, and it's too much
That's
to
what
track.
that's why I was asking about the enforcement, because
Right.
there's really not, and there wouldn't, I don't think there would be a
Yeah.
point of sale, because,
Just the reasoning though is the exposure to children, even if they can't buy, that they're out there on their counters, on their shelves, that was one of the reasons for even the consideration on flavors, that even if you can't buy it, it's out there for display. And so the exposure is there at a store that isn't an adult store.
So
I
you're
don't,
pushing more towards, you're saying,
Well,
I don't know
that's-
if it's
that's
up
where
to
it
us
came-
to limit what people's
It's where it
children
came
can
from,
see.
but yeah, no, it's
So
true though.
just to give you a couple of, just to kind of summarize, I'm just looking, because they have a separate section, like we have in our regulations, a tobacco sales permit, they have a separate section for smoke accessories. And it almost mirrors the wording, all the different sections. As part of the permit, you have to have signage up, and you have to follow the Board of Health restrictions, and the permit has to be displayed conspicuously. I would see where it really only differs, right? And again, we don't have to do this part of it, right? Is what they're saying is that they're not gonna give more than 3 smoke accessory sales permits, which is pretty interesting in a city the size of Framingham. Now, again, I think, and Diane, please correct me if I'm wrong, because I think you and I had the same concern. The biggest concern was under 21 can buy this stuff anywhere. And if that's really the primary thing we want to address, we need to define what smoke accessories are, and we have to put wording in there that you can't sell them if you're to people under 21. That's really all we need to do to accomplish that. We don't have to get fancy. We don't have to create another license. We don't have to create another.
But you think, and I know this is, I guess,
Well-
so that's, I think, the beginning stage, but I
Mhm.
think the other thing, because we're making changes to the regulations, we should maybe consider,
Mhm.
because if I remember correctly, please correct me, is that an adult,
Mhm.
I guess it's adult tobacco stores, I don't even want to say,
Right.
but
Adult
adult
retail.
tobacco store could sell all flavors of cigars,
Yeah.
cigarettes,
Yep.
smoking devices, everything, right?
Mhm.
So
That's
there
true.
may be a potential in the future, not that I'm saying anybody's in front of us now, but there may be a future, it might be in the future.
Mhm.
So we might wanna consider,
So-
There can't be in the future,
Actually,
because there's no more permits.
Right,
No, the
this
same-
would, this is a
same
different
establishment may
license, though.
switch
I mean, we
over.
could say no,
Right.
we could, obviously, because we have a limit, but it would be a separate license category, like they limited to 3.
Right.
I'm just.
No, it could be,
Yeah.
to be one of these
They
establishments
can sell
converting themselves.
stores, but they can't sell tobacco if there's no more permits in our town.
If there was an adult-only establishment is how
But there's no
Framingham is.
more, there's no
Yeah.
more permits, so it's
So-
a moot point.
Right.
There's
if-
zero permits.
I understand that, but what I'm saying is like Framingham did it, they have a separate license category for that. We don't have to
Oh, okay.
entertain it at all.
I
We don't
thought-
have
I
to,
thought
I'm
that
just
that's all,
saying
that we
that,
had 17 and
Yeah.
that was it.
and I'm,
Okay, so
18.
We have
18. Oh, okay.
17 out there presently. One will dissolve as
Right.
of January 1st if
Right.
no one requests it.
right.
so if somebody came in here and asked to sell everything, like an over 21 store,
Mhm.
paraphernalia, flavored cigarettes, and whatever, it would still fall under our current tobacco license.
Correct,
Okay.
where
Yeah.
they would
That's
be
fine. So
that.
if-
If-
that's
if
good.
all-
Yeah.
One of the
Until-
existing
Until
establishments
December
converts
31st.
itself
If
into
we
21.
don't
Yeah.
have one
Yeah, okay.
by December 31st,
They
we
can
won't
sell
have
them
one until
now,
the,
but
the-
they just
unless at
can't
some
sell
point in the
any- we're
future,
gonna change it. You
another
have to be
board
21
changes the
to buy it.
regulation to
Right, and I'm
It's
okay with
my
that,
understanding. Yeah.
I'm good with that
Yeah,
then.
no, I mean,
Okay.
okay.
So, Chris,
But-
just,
Yeah.
so my understanding then, the only the only town that actually does both, that sells marijuana and accessories out of that 7 groups
Mhm.
is Framingham. So I can see why they
Yeah.
would wanna
Mhm.
separate that
Yep.
to maybe make it a little bit more difficult.
Absolutely,
And-
yeah.
And I do agree with what Mark said about visibility to kids, and I'm not
Mhm.
for big government either.
Mhm.
But when you listen to the Amy Turncliffe and the people that come in from DEAT and the doctors that try to get kids to not smoke and off vaping, there's studies that are done that prove that, they go into these convenience stores because that's the outlet for cigarettes. You don't buy cigarettes anywhere else. There's no vending machines. There's no other place to get them. So when these kids go in there and they're continually bombarded by it, and you have big tobacco companies spending millions of dollars, like $750 million or $1 billion a year on advertising, it influences these kids. And our job is to hopefully try to keep them safe to the best of our ability. I don't like limiting things technically either, but I think that's a significantly unfair advantage that tobacco companies have with advertising money, you know, no matter where it's spent. You know, you see all the Juul advertising, that's all designed for young kids.
But
I agree.
They're not going
But they're
after
not in
50-year-olds.
the accessory
I know.
business, though.
Yeah,
Right,
no,
they're not, they're, I mean, I'm assuming that.
No, agreed,
Right.
but it's just the point
the
that
exposure.
they're gonna be influenced by what they see. They see it, they typically
Right.
wanna do it.
So here's something that just came to mind, and I don't know the answer, Mark, maybe you can help. We talked about a convenience store can sell smoke accessories to people under 21. Are they required to have a tobacco permit to sell smoke accessories?
No.
That's where we have to, so we do have
That's a
to
good
at least
point.
make the wording so that, because if we say
It's
you
in-
can't sell
right,
them
you have to
to
have a-
under 21, it only applies to people, if we're writing it in the tobacco regulations, to people with a tobacco permit.
And I'm assuming, I don't, and again, it's for conversation, I'm assuming there's no establishment out there right now that sells accessories that does not sell cigarettes.
But
You
they
know,
don't
you know,
have to
so-
report to you
They-
if
no,
they're
but
selling.
the problem is we have one license, so we have one license currently, so let's say we change the regulations come January 1st.
Mhm.
We only have one license, I don't even know, I mean, like,
Oh, I hear what you're saying.
I'm just
So
thinking there
somebody's
may be
doing-
somebody here in town
Okay,
that's selling accessories, I'll just say hair salon,
Right.
it's awful, but a hair salon that's selling accessories that would need to be licensed before January 1st to still continue that type
Well,
of
If
business.
if you add this regulation in,
That's correct, that's exactly.
So now we have the dilemma of, well, not
That's
really
an
a dilemma.
interesting little twist.
So we
Yeah,
have
it
a
is.
twist of,
Yeah.
if we, can we require a tobacco permit to sell smoke accessories? And maybe that's the reason that you create a smoke accessories permit too, right? Because, and then, yeah, so now we have, let's say, January 1st is here, we don't have smoke shops, and, you know, Fred's Hair Salon on Street X decides they're gonna start selling accessories. How do we prevent them from doing it and
Yeah,
regulate
we
them?
prevent them by not having a license, right?
So,
But I would,
It's one way, but what Framingham under E-1 said is a holder of a valid tobacco product sales permit, that's our 17 right now, as defined herein, that also possesses a retail food permit, which they all do, may sell tobacco products without characterizing flavors, but may not sell smoke accessories or flavored tobacco products. That's how they got the smoke accessories in there. So they're saying no longer can your convenience stores sell, in Framingham, so I make myself clear, smoke accessories.
so they eliminated them from convenience stores, they made a
Yeah,
separate
basically.
permit, so they have to be sold in a separate
Yes.
establishment.
well, you don't want somebody to come back here and say, I'm losing my business because you're asking me not to sell this product.
all right, yeah, number
So
two.
if you're putting a permit for me, I'll agree with you for putting a permit for me, but don't restrict me from selling it.
Well, and
So-
of
Right.
course, when the current ones that are being adopted January, I voted against it because I had my own beliefs of not restricting, if an adult wants to purchase, like Judy said, if an adult wants to purchase menthol cigarettes. So, I mean, that was my feeling then, and still is my feeling, and I absolutely think you have to be 21 years old to buy the product. I don't particularly have a preference on banning them from convenience stores. I don't think there's a big market out there. I don't see that they're in the windows, like we were saying about the tobacco products, the advertising, all of that is not geared towards the accessory products versus the tobacco products.
So if
But that's
I
just how
can,
I feel.
and what.
It's too
but
easy to
what-
get it online.
Yeah, no, and it's true.
Well,
How-
it's
but-
legal. It's
but-
not
But the
an
reality
adult,
is, right?
but I don't want somebody
We
14.
know that within the next year, there are gonna be active shops next door in
Absolutely.
Framingham. So there would be incentive for local shops here, for people who use product and need accessories to not, you know, if they're, you know, they break their pipe, instead of having to go to Framingham to get a pipe, they can get it, you know, on Front Street or whatever.
Right.
So there'd be, once the business models are established in Framingham, there'd be more incentive for our stores to carry those types of product if they could. So the question is, do we start looking at, you know,
Well, we could theoretically, again, like, if there was I'll call it a smoke shop, place that sells devices or accessories.
yeah.
If a smoke shop came in, we don't even have a license, so even if we included in our regulations that if you were
Okay.
selling accessories only, let's say just accessories, you need a tobacco license, but we don't have anything to give, so we
No,
could
no.
put it in there to prevent it.
Well, the accessories may be a separate license, not a tobacco license.
So,
No.
Those who have tobaccos, they could probably include that as a part of the tobacco license. But those who do not sell tobacco, they should have a license for accessories separately. That is what.
But KG, that's a good point, if I may. So right now, business A could come into town and say, I'm opening up a smoke/vape shop. They can do it. As long as they don't need tobacco in there, they can do it.
Right, that's what I was saying, that's what we were talking about, is let's just say we said, we're gonna license accessory shops. Anybody who has accessories, we're gonna license them under a tobacco license. We don't have one to give currently, but if we made a separate license, that kind of defeats the, like you were saying, we're
Right.
already at our cap, so we would have to add, let's say we gave out 3.
No, they're not going to sell tobacco, they're going to sell only
Yeah,
accessories.
But if
they
we're
still
requiring
need
them to have a
to
license-
do that.
But that
That's
could
what
be a
she's
separate
saying.
license.
Right, well, that's what she's saying.
Right, so
That's
then
what
now we
she's
have to say, okay, how many do you want?
Yeah.
So now let's say we have a adult accessory tobacco sales permit.
so, and that's not something, we can't ignore that, because there's still a couple
That's what I'm
months
saying,
left
that's
in
what I'm
the year
saying,
for
is
that
I'm
to
just throwing out,
happen.
like, how many, like,
But-
we would have to set a limit, like.
But now, the reality is, though, what we're talking about here is we're talking about modifying the regulations that go into effect in 2020. If something happens between now and then, we have to address it as it comes. Here's my concern, let's say April, one of our current tobacco licensees decides they wanna start carrying smoke accessories. That's the question we have to answer, how do we wanna,
We have no
right now.
restrictions right now, but we wouldn't know whether to do it or not unless somebody goes and says,
Well-
okay. And it's not against law as of now.
Well, that's what we're looking to
Right.
affect right now.
So-
That's what we're looking to.
Correct.
So to begin with, no matter, I think we all agree, no matter what, 21 years of age or older you have to.
Right.
So I guess the next question is, okay, so we know that we want people to be 21 years of age, but do we want to restrict where those items are sold? That's really how it is, because it's,
Yeah, can anyone sell them, or do they have to be,
uh,
do they have to be a holder of a tobacco license?
I-
I like what you said, I like the 2 different distinctions. I don't know that anybody's really gonna spend the money to come in if it's available so far around to just sell accessories. I don't know the kind of
Right.
money that's involved in that, but I like your idea, because then that would still restrict access to kids, but still allow legal adults, if you will, to
Well,
purchase them in
yeah.
our town if there's a retailer that wants to do it, and then we can determine how many licenses, just like you said, that they have to give,
so
and
have
that
a
way,
separate
they're still
license
separate.
for it.
Well, I think to partly address Judy and I think some of your concerns, right? That we shouldn't not allow people who can use them, right? So obviously 21 is the age, right? If we make it so that they can only be sold by holders of a tobacco license, I think we cover all those bases, right? So nobody new's gonna come in and just randomly grab it.
And they would
we-
need to have a tobacco license.
Our existing tobacco licenses already have to follow tobacco regulations, and we make this part of the tobacco regulations, and we simply
I think
have a
that's- yeah,
statement that you're
absolutely.
required to have a tobacco license
What
to sell them.
What happens between now and December 31st? 10 shops open up here
No, you're
with
right.
smoke accessories. They say, look, I'm here. You're
I-
trying to shut my
You're-
business
you're-
off.
You're absolutely.
And you're not giving me more permits on the tobacco.
So
I
is
can't
there-
sell it. I can't live.
Let me ask a question.
Grandfather
So if
that
you're
That's
coming
right.
into town and you're opening a business, what do you have to do at town hall?
We just have to file for a license to open a business.
Okay, so
And
when
if
you
you're
file
buying a
for a
food permit, you
license.
have several restrictions to do it.
Right.
But if you're
Right,
going to
well-
just stock something and then put it up there, I don't
Let me
think-
finish my thought
Sure,
line.
sorry.
That's okay, cause I have a very short memory, so if I don't, if
Same,
I don't
everybody
keep,
has.
alright, where was I? So, when you come to fill out a application for a business, why can't the Board of Health hand something to the person, who's that, the town clerk that does it? What
Yeah,
department?
she would automatically
So,
send them to the.
By the way, if you're planning on selling these, know that as of January 1, you're required to have just with anybody that fills out a business application. If you're planning on opening a business that sells paraphernalia of any kind, know that you will be required to have a tobacco permit,
That's
January
fine.
1.
I'll apply for,
Right?
But
no,
But
I'll
that-
apply for it,
sense?
but you're not
that-
giving me.
That could be legally challenged,
Could it?
yeah, because you're putting basically your
Could you check with
prevention.
the town attorney?
Yeah,
have
that
one,
question
though.
came up at the beginning. Do we have a smoke accessory shop in town?
No, we have
Oh,
one person.
license.
So hypothetically, if one person came,
Yeah,
I mean, the other thing is we could have a public
Well, we-
discussion and make
so-
that, I mean, we could change the date of the
So
regulation.
if I can jump in for 1 second, maybe this addresses your thing, right? We can, just as we just talked about, you have to have a tobacco permit. We can obviously change the, add that wording to the 2020, but there's no reason we can't modify the current regulations either, and just add it to the current regulations.
But Chris, I like your idea of kind of simplifying like that, but if our goal is to really try to keep this out of the hands of kids that we don't wanna get it, then I think you gotta get it out of the convenience stores. Cause I think it's the same deal as when they come in and they see they're bombarded with cigarettes and Juul stuff. And I'm not saying it's not easy to get online either, but I think if that's the motivation to do it, to keep kids that are under 21, then I think you gotta decrease the ability of them to get it, because we know that, even though the statistics, when we were fighting the flavor thing, when the lawyer came in and said, you guys are great, you pass 99% of the time, why are you restricting it? Because
So-
we know that's not the only place, and it can happen with
But-
21 and over too, but.
But the thing is, I mean, for me, when Sam came in here, Sam came in here and said about the age, I had no idea, like, I always
Yeah,
assumed,
I had
just
no idea
assumed,
either.
yeah,
Right,
but
doesn't seem
I
right.
don't know, I don't frequent a lot of convenience stores here in town. I believe know
Just Lucky
one, but no, I know that.
I never go into a convenience
But I
store,
think there's
so.
one that I know of
Yeah.
that used to, I don't even know if it still sells paraphernalia, so I mean, we're talking about a problem that may or may not
Right,
really be an
correct.
issue
But-
right now.
No, okay, I don't wanna interrupt you, but
Yeah.
just to kind of play devil's advocate, cause
Yeah,
I'm with you,
no,
look,
go
if it
ahead.
was up to me, I'd ban tobacco sales completely. I really would, but it's not my decision, you know what I'm saying? So, the reality is, to that point, so we just say, let's just say we create smoke shops, right? So that it's a specialized shop and you have to be 21 to walk in. For the same way that the under 21 person is gonna get it from the convenience store.
No, I hear you.
They're gonna get it the
Oh,
same
no,
way.
absolutely.
So
Yeah.
No,
I think to
I'm not
simplify
gonna
it,
disagree with that at all.
if we change the regulations, you have to be 21 years of age to buy accessory products, and you have to have a tobacco sales license to sell accessories, we're covered. Because we have a limit on the tobacco license, they're limited on the age, and whoever currently has those devices, we don't have anybody that we know of that's coming in front of us, so we're not trying to penalize somebody, but we're just including it in the regulations so we don't have whatever they're using the accessories for, we don't have more smoking establishments that
And
sell
I'm
tobacco products.
and I'm sure there's rules and regulations about where you can put cigarettes, they can't be like, at eye level of a
They're-
3-year-old,
yeah,
they're up on a
they're
shelf
in the
behind the
regulations.
counter and,
But the advertising can be,
well,
Signs in the
do we
window.
have any control over that, Mark?
no.
Alright, so,
But the only control you have is getting it to an adult retail store. That's how you can control it. That's what Framingham's main purpose of this regulation is. Get the adults to the adult store for various products, because the advertising you cannot control. It's against constitutional law.
So eliminating it from retail and making it go into an adult-only smoke
Yeah,
shop.
This whole regulation's based on exposure. In fact, if I can just read the other two, it says a holder of a valid smoke accessory sales permit, this is E2 in their regulation, as defined herein, may sell only smoke accessories.
Yeah.
Adult-only retail tobacco stores, they get a little more, as defined herein, may sell tobacco products, flavored tobacco products, and smoke accessories. Again, they're worried about getting that, the 21 and over, that's what they wanted. And marijuana, which we don't have here, but
Right.
retailers and registered marijuana dispensaries, defined herein, may sell smoke accessories, but not sell tobacco products or flavored tobacco
So the
products.
second one, Mark, so that says that somebody who has a tobacco license can sell accessories.
No, only a holder of a smoke accessory unit. It doesn't say they have to have a tobacco permit. So they don't have to have a tobacco permit.
And that's why they separated them.
And the reason they did that, Sam, I don't know if you remember, noted that they had over-concentration of vape shops.
They do.
In Framingham.
There's
So
quite a
this
few.
is how they were gonna prevent an over-concentration of vape shops, and that's how they did
They
it.
can have 6 dispensaries?
I know, so that's where the vape shops will probably go, is within the
Right,
dispensaries.
right next door.
Just for
Yeah.
clarification, because I read a newspaper article, which doesn't have anything to do with our regulations, but when Sam was here, he was very good about educating on us, on their regulations. When he had said they're having 6 retail establishments, the Route 9 and Route 30 corridor, I thought he was talking about literally the Route 9 and Route 30.
Oh.
He's talking Route 9 and Route 30,
Right.
the whole,
Yeah.
like, I thought it was
X.
just the perimeter. No, it's those 2 roads, so it's
Yeah.
pretty spread out. Glad we don't have that issue.
No, you definitely have different
Yeah, I know.
demographics here. They created
Thank
these
you.
to try to,
I
a couple things.
If I was gonna open one, it'd be on High Street.
Yeah, right, exactly,
Yeah, Chris.
That would be in my neighborhood.
Can I ask Mark a quick, so you do this for the last 30-some years.
Yeah.
What do you recommend?
I recommend, because we can't control advertising, is to try to get sales of tobacco, sales of smoke accessories into adult retail facilities.
But then we can't tie that to the current tobacco licenses, because then
No,
nobody's
no,
coming in here,
as
so
they
we
go-
have to have
as they-
separate permits
yeah.
like you originally said,
Yeah.
so.
But down the road, and that might take years, because we have 17 existing permits.
Right.
In all fairness, that would indeed put probably a major damper on them, unless they were thinking, well, we're gonna take part of our building and just make it an adult retail tobacco store only.
What I think would be kind of interesting, and I mean, if somebody wants to volunteer to do it, if Mark is just, I mean, how many people are we talking about here that would be affected? Let's just say we eliminated it from tobacco sales permit establishments, the places
Smoke
that sell-
accessories?
Smoke accessories. Does it, I mean,
Well,
it gonna-
decisions at every turn
I'll run
was,
around this weekend,
Yeah.
if you give me a list,
The
and I'll
reason
go
why I
to
asked it
every
is
store and
because
see
we
what they have.
we obviously have a big change for them coming. I mean, again,
Mhm.
I know everybody says it's not about, you know, the business, but it is, let's face it, we have a big change coming
Yeah.
for them.
Right.
I mean, we may only be talking about 2 people out of 17. It might be like, well, I only make $1 a year, so,
Well, again, but not, I think their comeback is gonna be that they expect that that's gonna grow because of Framingham opening up the shops.
I know Decisions at
Yeah.
Every Turn did have some data on this, because they were concerned 3 to 5 years ago, and they brought it to my attention. And they were gonna have a summer intern review that, but that's 3 to 5 years ago. I don't know if they have
I know they're gonna do
that
another
data,
survey. too,
but they may know who sells the paraphernalia. They were very, very concerned about paraphernalia, as Ron noted earlier.
Yeah,
I also don't wanna push somebody to open up, and, I mean,
Do you,
I know we're on the record, but I mean, I don't wanna also take it out of retail and say, have somebody come and go, well, fine, I'm gonna open up a smoke shop.
well, that's, I think,
just-
I think the work, look, we really did a lot of work putting together what we have now that goes into effect in January. And I think that speaks to a lot of concerns. It doesn't satisfy 100% of the people, and that's never gonna happen. It's just never gonna happen, right? But I think we, you know, by giving the amount of time we gave, we really gave ample time to the retailers to make up.
Absolutely.
I think the examples that the retailers gave us, I ran the numbers, and you're talking about a really small amount of money to make up. And I think that,
You thinking the same for this?
I just think for this, by doing what we talked about and just rolling that into the new regulations, defining smoke accessories, ensuring that 21 plus is stated very clearly to purchase them, and requiring a tobacco license to buy them, I think that, you know, look, I want tighter regulation on this, I do, personally, but I have to be realistic in what's adaptable. We saw the people that we serve and how they reacted, right? So we can't pull too far away without being realistic in what our goals are, you know? I mean, I think that by addressing the fact that you can't be 16 or 14 and walk into a store and buying one, I think we've done our part of the job. There has to be responsibility by everybody. Our licensees have to be the primary responsibility, right? And then the adults around the children we're trying to protect have to take some responsibility as well. And I think that, you know, we can come up with a million different ways to wrestle with this. At the end of the day, we're either gonna ban something or not ban something, or charge for something or not charge for something. And You know, I think that it fits in with the tightening we've done the big pull, you know, and,
I think changing the age is just,
you know, you know, we make that change, we make it effective with the new regulations on 2020, and look, once the new regulations, I think we've had ample time now to see things, you know, we've heard all the scares and threats from the lawyers, and so far they've all gone kaput, right? So it's all hogwash. I think that we're on the right track, and I think we're doing the right thing. Let's bring this in, let's let January come, and let's see how it works out. 6 months into 2020, we'll revisit it. Maybe we'll bring in the retailers and kind of get their pulse, and take it from there.
I don't foresee any bad thing about restricting this 21 for
Yeah.
accessories. We should, definitely, it's all
You
positive.
know, we can sit here and.
My question
yeah.
is whether there is a separate entity which sells only these things.
And we're gonna have to,
We
I
can
think-
give them a
yeah.
license, that's fine,
Yeah.
but they needed to be tied with the tobacco license, then that's a problem,
And-
because we are not giving them additional licenses.
Yeah.
You're not permitting them
You're
to
right.
sell it.
You're 100% right.
If they
Right.
say, look, my business only is this, and I cannot do this business because you're not giving me additional permit, I'm willing to take it, but you're not giving me, what can I do?
We're totally correct.
So that's
so-
where the issue that I have.
So,
Restricting the age, I have no problem.
so with the fact that we have right now one outstanding permit that will only exist until December 31st, in the case somebody comes and says, I'm gonna open up a tobacco shop, and they wanna do this, then they come to us and we make, just the way we did when the mobile station sold their business, what did we do? We made an exception.
Right.
And then we take a vote as an exception, you know? We make a decision as a board, they'll present their case, we'll have people speak on it, and we'll make a decision at the time if we need to.
But then you're saying, then that's a pretty good monopoly for one person, right?
Well, it's the
I'm
way,
just- I'm just
yeah,
saying,
you're right,
you know.
but it's the way,
So,
sometimes that happens.
yeah, okay.
Sometimes that happens.
or we, you know, we could just say, we don't have any licenses, you have to wait till one becomes available.
Yeah.
It could be as simple as that, is then it wouldn't be put on us, or it wouldn't be
Now,
Yeah.
setting a precedent for, I mean,
I just think that's,
Looking
I think
beyond-
that's very restricting, you know, I'm not gonna go against what everybody, what everybody
you think
thinks,
that's-
but I still like the idea of limiting the exposure. I think that's to me the primary goal for me, is to protect kids that don't have enough up here to potentially protect themselves, not, enough, not that I don't care about the adults, like you
Right.
said, but they already made that choice.
No,
a long
and I'm
time
with
ago.
you.
These kids are the people that I think all these regulations are for. That's what we care about the 21 for,
Sure.
that's why the state raised everything.
now what were you thinking was more restrictive, maybe I missed that part, about,
I think if you're only gonna tie this to, if you're gonna tie it to tobacco licenses and say now we only have one tobacco license, that means there's only one opportunity, basically forever, for an adult smoke shop in this town, because
Yeah.
we only have one, and the idea
yeah, I
was
see what you're saying.
when one went away, then that was going away forever. The idea, hopefully, that it would decrease the amount of outlets available for people to buy tobacco, and namely for kids to get it. So it was all about restricting availability. So we didn't care about, not that we didn't care about an adult, I had the same concerns
All right.
Judy had, when I'm saying, you know what? These are legal flavors that adults should be able to buy, and now somebody who smokes Cools can't go down to the local store and get them in Ashland, so they got to go somewhere else, which I don't necessarily like doing, but I'm willing to trade having an adult be more inconvenienced than having to go to another town, as long as I can keep one kid from
So make-
starting to smoke.
make it
So
an adult-
I think that if you're gonna do the smoke shop thing, that I think you gotta keep it separate from the tobacco regulation. That's just my
But now
feeling.
technically though, Ron, when we made those, and maybe this was the flaw in what we did, based on that argument, right? But technically, when we built the 2020 things, there were no available licenses, so there would be no shops. It
Right,
just
then there'd be
happened.
none,
Just happened by luck.
unless we did what Diane said and said, all right, well, now we're gonna make this a separate entity, which is what Framingham
included in there,
did.
but it would be a separate license.
It would be a separate license. Yeah, I
That-
mean,
that-
Smoke
that
accessory
doesn't-
license, you mean?
No, no, that's
That's-
only,
that's
that's only
basically a
accessories
smoke
only.
shop, right?
yeah,
you would
smoke
have-
shop
right.
license instead, you can't sell tobacco and smoke accessories together, but, you know,
Well,
you can sell them at, we can have a smoke shop in town if we decide we wanna do that.
So I think Mark's at the beginning said he was
By
gonna look
definition,
into it,
only
but
selling
we
the
should find out if
Only
we
the
can.
paraphernalia,
Not these tobaccos.
right,
Okay.
at least for,
We should find out if we can,
correct.
ban
Put a complete ban.
in retail establishments and only allow the accessories, and that's what you're gonna find out from council,
Yeah,
right?
I was gonna ask on a complete ban of smoke accessories.
And only allow it in, I mean, again, I don't know that that's gonna be any different, but
Right, I don't know
I
either,
don't know.
but,
I mean, but if we do allow it, like, just as a smoke accessory, then we're not banning it. It's when you say no smoke accessories. and-
right, if we only
Then,
allow it in
yeah.
certain establishments, but,
right,
That-
then
that
at least
wouldn't
we
be a
have more control
Total
over
ban,
it.
that
right,
would
you
just
have to have a
like-
separate
Look, I'm
license,
all
separate
for that.
establishment.
Yeah,
So, Mark, why don't you just, so in the interest of time, because again, we're not gonna meet again until August.
13.
So, if you can get that information to me, Mark, I'm gonna be away the next week and stuff like that. What I'll try and do for the next meeting is I'll create verbiage to cover several different scenarios so that we can kinda see what it looks like in the context of our regulations.
Yep.
And then we can review it and talk about it.
Yep, and then we'll talk
at
about
that
it
point.
August 13th, and then I believe we said we were going to try to have some, type of a, public forum in September,
Mhm.
maybe towards maybe the end of September.
There are a couple of, in reviewing the regulations, a couple of questions I had that I wanna make sure that we protect ourselves in covering. So just based on the current regulations that we have now, we talk about, new applicants will be placed on a waiting list. Right, so, right now, a waiting list doesn't exist, right, because we have that one open license.
Yeah, and no one, there was one interested party, but he went
Right.
away.
But there isn't a waiting list.
At this point,
So
there's no one
again,
on,
it
we
may be a
don't
moot
have
point.
anyone on a waiting list, put
So
it
my
that way.
question is, as
yes.
of 1/1/20, the need for a waiting list goes away, cause we're gonna be surrendering licenses. And the
Correct, no
question,
more waiting list.
Well, there will be if someone else surrenders a
well,
license.
this
Although
is,
it-
this is my
No,
point.
they won't. Yeah,
Yeah,
you're
they
right,
won't,
you're
right.
right. There
In
won't
the
be a waiting
case-
As
list.
they surrender or as we suspend, it's gone.
In the
That's right.
case
That's right.
that there is a wait list on 1/1/2020, when the new regulations go into effect, do we need a statement that invalidates or dissolves the wait list?
Correct.
Yeah. And right now, there's none, but if there is somebody on it,
So I would
they best move by January
maybe put that on your
1st.
council question,
Yeah.
because if somebody is on a legal waiting list now, and our regulations change, I don't know, I don't know.
I mean, he also
So,
claimed that if
the-
something contradicts the other one,
Right, so.
that's what he
Jan-
says there somewhere.
Okay, yeah, all right, I'm thinking,
But-
The regulation itself states that, like, let's say it's January 5th, someone surrenders a license, and there's a wait list, there was a wait list carrying over. The regulations state that license dissolves and doesn't
Correct.
exist any longer. So does it matter, because even though there's a wait list for something that doesn't exist?
correct.
No.
What
doesn't
takes
make any
precedence? Does the regulation dissolution of the license or the
I don't-
license take precedence over the wait list?
I
So
don't
we
think it
just
would
need to
be-
get rid of it
yeah.
because it's going to be effective 1st January anyway. At that
Yeah.
moment, whatever license is surrendered or whatever we revoke
Right.
is gone.
What I wanna protect ourselves from is, again, it may not happen. Let's say there's a wait list of 1 or 2 or any number of people on January 1st. Do we need to verbally state in either the regulation or somewhere that the wait list has been dissolved?
Correct. You need to state it somewhere.
Yeah, I was gonna say, I mean, Mark can check with council for some
Yeah.
wording to put in,
Yeah.
okay, just make sure we're
So-
covered, cause it's,
So if business X comes in, say in September, and wants to open a business, they would probably do it, they wouldn't go on a wait list. If business Y comes in and says, I just, not for sure, but put me on a wait list,
Mhm.
well, they would be notified at that moment that that wait list is gone as of December 31st.
Well, okay, so that,
Yeah.
at this point, since there isn't a wait list, I think that's a good point,
We don't have a wait list, do we?
No.
That one person never came back.
right? So
There
if
was one
anyone were
person.
to go on a wait list between now and December 31st, as long as we disclaimed it at the moment that the wait list expires on December 31st, at midnight or 11:59.
We'll have to give that disclaimer at the
Yeah.
time they come
At
in.
the time, then I think.
Mark,
we're
not to
covered.
well, so not to throw another fly in the ointment, if somebody said, well, I'm not sure, but I don't know how much a tobacco license is, could they purchase it without having a retail outlet already and have it?
No,
They
that's
have
in
to
the
have a physical
regulations.
Yeah,
They have to
the
show an
outlet first.
establishment.
Okay.
Well, and
That's how, cause that could happen, that's how you
Right.
get around that one.
well, even the same thing is what if somebody applies to one and they're in the process of remodeling or whatever, and they haven't actually been issued one, until, they're not ready.
Yeah, they would have to be issued one, I would tell
Right,
you.
so if they paid and
Even if
applied,
they're
they would be
renovating.
official probably.
Okay.
Yeah,
Okay.
as long as they had a
Oh,
physical
goodness.
facility with an address that they're gonna renovate, they could probably
They
get
could
that.
I thought that it said that they had to sell food there.
And they can get a food permit too.
Can. They don't have to.
Oh, they don't?
They're not required to sell the food. They sell the food there because they get people
Okay.
to attract and show
I like
these
some
other stuff.
tobacco with my food.
That's a,
Ribs and tobacco.
So I just wanted to make my point clear,
Go ahead.
because I do a lot of volunteer work, and a lot of the people roll their own cigarettes,
Mhm.
and so they don't pay Marlboro Company for their cigarettes. This would preclude them from getting loose tobacco and rolling papers to go with it.
No. they
So
can
the only
still-
thing that would
If you
change
have
for them is
separate.
they would have to be 21 to buy the
And I
rolling
agree with that
papers,
100%.
right.
That's it.
But, so are we back to talking about you need a tobacco permit to sell this and you have to be 21?
Yeah.
Or separate places, cause I know
No,
we've.
no
got-
separate
Just the-
places.
just,
Okay,
yeah, so that, those people, as long as they're over 21, they can still buy the rolling papers.
okay.
If they're 18, because again, I know people who do it as well, but
Okay.
if they're 18 and they do it, they wouldn't be able to buy the papers.
Good.
Well, the
They can't buy the
tobacco.
cigarettes either, right?
Right.
Or the tobacco
Or
products,
the
but,
tobacco.
yeah,
Right.
right.
Okay.
So it's just kind of keeping it in line with all the other,
Okay, good.
okay,
It was good, lots of good ideas,
yeah.
yeah.
Well, plus it's like when you read the other town's regulations and bringing it all
Yeah.
together, it's,
Thank you, Chris, for your extensive
Yes, thank you. Are you
research.
all
Yeah.
I really
set
appreciate it.
with your questions?
You
Wow.
passed your exam.
I think like Framingham's a good example,
Yeah.
but they're
But
gonna
it's
have
also
6
different.
dispensaries.
Right, it's also different, and it's also different, so
different demographics.
it's good that's what's good about having, you know,
Yeah, regional kinda,
a bunch of people with different
Yeah.
right.
perspectives, sharing their ideas. Our job isn't to agree with each other on every decision, our job is to share what we know, what we believe, and what we feel, and what we learn, and then come to a resolution.
I would love to know if anybody's doing it right now and selling it to kids.
Yeah, do you
like-
wanna just kinda
I don't know,
check
maybe
it
we
out? I
could,
mean,
Yeah.
we can all check
we can all,
check it out, yeah.
No,
yeah, we can, take
yeah.
the list of.
Yeah, I
I'm
kind of,
happy.
since I started doing this, I've been in one or two convenient, I've been
Oh,
to
yeah.
Lucky
Right.
Farm and I've been to whatever, and
Right.
I did a spot check and I didn't see anything.
Yeah.
Oh, that's good.
Yeah, that's good.
Yeah,
Yeah.
I mean, I can easily do that by the time the next meeting is, I can
Yeah,
get to
just-
all of them,
just-
just let, I'll
Yeah.
just.
I mean, I
get a
guess we all,
list.
yeah, can just.
Yeah, no
just
problem.
curious. All right, moving on, Mark, FY 2021 budget review
yes.
and preparation.
So,
5.
we have both the FY 20 budget, which was approved, and you should have that in your folders. Is that FY 19?
19,
Okay.
yes.
Well,
Okay.
it's FY 20, is this one?
Yeah, that's for 20.
This is
It
FY
says
1999.
percent use, 100%.
This is year end,
Oh, so this is the year end, so
that's
on
fine.
the year end, we were over 2%. And there was a discussion with our financial director related to another expense that was charged to our account that we weren't familiar with, and that's the $5,000 that town meeting approves for the My Services to do food work, food establishment work. Might be inspections, review of new facilities. So they take 5,000 out of our revolving account, but somehow, she was telling me, it got placed into our budget. And I said, well, that'll definitely give us a negative, because we don't plan for that 5,000. But it's there. The money is actually there in our revolving account for our food inspections. But they're just doing mathematical calculations to determine that amount that was used, and maybe
I'm
someday they'll.
totally confused.
It's confused me too,
So-
so they took 5,000 from our budget, but it really came from the revolving fund.
Food establishment?
Yeah. So when I went to see Brittany, she goes, "You're minus 4,800." I said, "Huh? How'd
So
that
they
happen?"
should be
She goes,
taking it from that and putting it in yours.
I agree.
So they did the opposite?
She's gonna do some creative
Okay.
calculations to make sure it shows
We'll
up
check tomorrow,
properly.
okay.
Yes. It was very confusing to me, Diane.
Okay.
I said, it can't be. So,
This is already confusing to me,
I
and
say we
added
put
that
the
they're
zoning
creating
on
more
this.
confusion.
Well, don't you have a code to use those funds when you do
yeah,
that?
we
Yeah.
do, but in the long run, management and financial, Diane keeps a good eye on it for us. They figure out other methods of calculating revolving funds, I guess.
Well,
It
with
kinda
that
threw me
said,
off,
so,
Diane.
but with that said, just with you doing food I mean, I know obviously we have Tom, but with you doing food inspection, is that the whole purpose of the 5,000?
Yes,
To
to
offset
cover
your
for
budget?
those, to cover the
Okay.
cost from that revolving fund that I spent time on.
Right, so they're supposed to put it in, not take it out.
That's what I thought.
Right.
Thank you.
Okay. I'm like,
I'll let you
they were
talk.
supposed to.
That's why it's revolving.
I know, okay,
I was wondering too.
Okay.
all right.
So if you know, but I think as a whole, we did pretty good considering, especially the additional nursing services we needed. And that was due to TB cases and most of it, and additional communicable disease cases. Our public health nurse is here 5 hours a week, and unfortunately, even today, she was doing work on this year's budget for, we'll go over that in a minute, but childhood vaccinations, but she also had like 3 communicable diseases that had to be resolved. So some days you can get 1, some days you have none, some days you get 3. You know, you just never know with public health nursing and with what's out there. So we're seeing a lot of tick-borne disease issues coming on too at this point.
Those aren't considered communicable anymore, right?
They're not, but she has to investigate them, so she does the calls on them. But they're not communicable, it's just they get reported though.
Yeah, they get
on-
reported, but
on
there's
the-
no- yeah.
On the Maven system, so she reviews those as well. But they're not as complicated as, say, a foodborne illness and so forth. The other part of the budget is FY '21, and we were going to start the process of discussion. I presented last year, I know I'm repeating myself, for 2 positions, an assistant health agent and a full-time public health nurse. That was not accepted last year, but again, we went through a lengthy process, as 4 of you know. And it was lengthy because it was, trying to figure out what we were going to be doing and presenting to management. And there was discussion on maybe should we choose one. So at the beginning, we chose the public health nurse, and for reasons that we are putting more time into public health emergency planning. And most cities and towns now are utilizing the nursing services to handle that part of the public health program. So that's emergency preparedness. Might it be for a man-made issue and sheltering, or if it's a natural situation such as a hurricane. Man-made would be anthrax or something like that, where we have to vaccinate the entire town within 2 days if we ever had that type of exposure. So it's a very serious part of our position now, where we never had that till, unfortunately, 2001, 9/11. But the state recognizes it, but some of the best partners in that are your medical people, the nurses. So health agents still participate, but the nurses are participating more and more based on medical needs. In discussion with management, he felt that hopefully we can regionalize that type of position someday, possibly with Framingham. Presently, though, Framingham is saying, if you want to regionalize or if you want to utilize our services, you need to pay us. We were very fortunate through past years when budgets weren't as limited to send people to Framingham, and they would kindly and very generously handle our population. As of last year, when Sam Wong was in there and the new city was formed, that changed. So that's why I felt that was a critical need that we were going to have to address. The assistant health agent on that side of it, I felt that that could be mostly funded through these revolving funds, especially the food revolving fund. KG, I know you support more hours, I do too. I would love to see us dedicate an assistant health agent to 24 to 30 hours a week on food programs, and we have sufficient funding. We have, I just checked yesterday, I think 50,000.
So you thinking the food inspector and the assistant health agent would be the same person?
It would be the same, that the funding from, as they do for me, the funding from the food inspection program, which we have 39,000, we're gonna get another
Good idea.
amount of money for the fees that we collect for the annual permits.
So
would
what's
help
the-
to,
What is the annual income from that collection that goes into this?
oh, we did that once, what, 25 to 35, somewhere in
So
that
that's-
range. I hate to give you a range of 25 to 35,000.
That's the number that we can use it for overall, because we can't
We can
draw,
get right to the
we can't
number.
draw more than what we put it in every year.
Right.
Yeah.
So that's a limit.
So, yeah, and I can get the actual number, KG. Tonight, I was just gonna talk in general, cause as Mike Herbin, when he came here, said he's trying to, you know, make sure we gel our ideas as a board and my presentations to you and see what the board wishes to do. But with the assistant health agent, we could also raise money in Title V inspections, because Title V inspections are not witnessed. Title V inspection is when you have your septic system, when you're selling your house, you have to have your septic system reviewed. And there's been some concerns with the work that's being done out there, that especially systems that shouldn't fail have been failed, and there's some concern with conflict of interest, especially if the person failing is actually installing the replacement system. So there's a group out there of septic inspectors who are asking boards, which is very unusual, asking us to be part of the process, which would mean when they come in for historical review for records, to the point of when they do the inspection, we could charge a fee to go out there with them to do that oversight, just like we do with soil testing. When you go to replace a septic system, they just don't go out and soil test on their own. It's witnessed. And that way, we have a view of what's happening. So the same concept's being considered for Title V. And we have approximately 20% of our households on septic systems. And when you look at around 6,000 households, that would be around 1,200. So 1,200, and Judy, you might be able to help me. I'm figuring 1 to 2% of 1,200 may sell on a septic. I don't know if that's our sales rate. I mean, how many houses transfer per year?
That have
I
septic,
took
I
a-
couldn't give you that number.
I took a very low number. I said, even if it's 1%, that's 120 households transferring in 1 year.
No,
Or even
12.
if it's a 0.5%.
1%.
1% of, what did I say,
1,200.
20% of
You said 1,200.
1,200.
1% of 1,200 is 12.
It's 12, so if, oh, that's right. I'm sorry, I'm up to 10%.
Well, I think also is that, you
But
know,
we see about 25 to 30 applications for septic repairs and so forth,
So
so,
about 2 to
so that's what I'll
2.5%.
use. I'll use,
Okay.
that's about what now, then,
2
you're
to
right,
2.5.
percentage, yeah. So, that seems reasonable, so.
well, and I think if we come up with the different
With
different
that, thank you.
revenues, you know, the different revenue sources, we're talking about the food inspector, you know,
So
food
we
inspector,
could
or
probably
there may be.
review the rates for the permit itself and
So-
find out what's needed. One.
Yeah, I mean, that's, I'm planning to ask the
Yeah,
board to
then-
review the, but go ahead, Dan, I'm sorry, I didn't.
So
The
then-
next
No, I was
one,
just
the
saying is
fees.
that when we, you know, do the budget preparation, I think we should do an A and B scenario list. I think we should, you know, go through the process with management and also go to the city of Framingham. Because Michael said they're interested, so I think,
Good.
yeah, I think at this point, I think it would be, Michael suggested that you and I meet with the chair and the health agent there to brainstorm about what services they can provide. Because this all started because of the nursing services, like he was explaining. So there's a fee, even if we're just addressing the nursing services, a fee, but what's the fee? Is it a reasonable cost to eliminate that problem? And maybe they have, maybe all we need to do is budget for an assistant health agent. Maybe they have services to provide us and we regionalize for everything. So, I mean, I think we should plan both at the same time, because we might be able to get a better bang if we regionalize. I mean, they have their city, they have a lot of services and they're interested, so I think it's worth a conversation with them.
Yeah, and you were mentioning, I missed the beginning part of it, but you were talking about we would have to vaccinate the entire town within 2 days.
That's if we had a public health emergency
So-
with anthrax.
So, okay, so something like that though, I don't think that's something that we would budget for. I mean,
No,
you
no,
know what I'm saying? That's not
just-
really part of
I'm
the
sure-
We'll reserve for that.
We don't
Right,
budget,
exactly.
but
That's
we
an
need to,
emergency.
but we prepare
It's a
for it.
cri- oh, exactly,
And that's where
absolutely.
the time.
Yeah, but I'm sure the
That's
state would,
crisis. I mean,
the
that's-
state
you
would
got the
step in
state
at that
involved in
level,
that,
I'm
you
sure.
got
Oh, yeah.
MEMA,
Yeah, but they rely on the
100, I'm sure they'll
locals.
get up.
Yeah.
Don't mean to interrupt, go ahead, KJ.
Well, and I know we were,
I said, the state would probably step in at such large
Well, they
issues.
would to a point. If it's statewide or many towns, then what would happen is, this is how it would happen. They would transport to us the vaccine. They rely on the towns to do their own work. They are not going to be here. I can promise you that.
well, I think.
So with the Medical Reserve Corps, it needs to be built up.
Right.
Public health nursing
But I
does
think
that
we could
too.
do, just like if, I mean, I think in general, like if we had that case scenario, I'm sure we could pull it off
Oh, yeah.
with personnel, and I'm sure the town would find
Yeah,
the
I'm not trying to
resources
scare-
to.
Prepare-
Yeah,
We
but I
would
mean, it
ask the
scares
school
me. It
nurse-
gets
no,
my blood
no,
pressure.
we would ask
You
the
know?
school nurses to help, all the medical professionals that might be in town.
Yep,
We have the Medical
Yeah,
Reserve
yeah.
Corps right now that's
and the town
willing
would come up
to,
with funding too.
so we have medical people on the MRC, but limited, cause we haven't had, which is great, knock on wood, much activity.
We don't have a list of medical people in this town, do we?
The state does though.
State does, so
You
they
can
can.
pull the census by whatever occupation you want.
Yeah.
Oh, and they will give you that, but.
Yeah, I think
Call out
if
for
we
help.
prepare the budget, because I think because we were a little bit late in the game last year and we had Michael here, I think that if Mark sits down with Michael, I think whether he comes here or Mark presents it to us, once we actually have it down on paper, Mark can present that to him, and hopefully at the same time we'll have the information, hopefully, from Framingham, and maybe, because then at least we have, to me, we have two options.
Right.
Okay, we want X amount, this is what we want. Chances are we're gonna be cut back, but maybe it's again, a better bang
Yeah.
if we do Framingham, so at least we can look at it and make a,
Yeah.
we as well as management,
Yeah.
these are our two options.
Yeah, I mean, I think as long as we have, you know, I love the idea of having two options.
Right.
But it's really important that we're clear on the rationale for every penny that we're asking, because that's where they say, well, that doesn't make sense to us.
Right.
You know, you have to
And
be able to back up what you're saying.
Go ahead, Judy.
That's the biggest part.
Yeah.
Hold on one second, Ron. Go ahead, Judy, second, I need to get my thought out.
I'm going way back to a part of the discussion.
That's
Um,
okay.
So, Mark,
Yep.
quickly, so you said, you know, you're asking for an assistant
Health agent.
health agent. And some of the ways you might consider funding it is to do oversights on septic 5,
Title V
Title
inspections.
5s, because you think some septic 5 companies are,
Not that I think, but it's been
General.
proven by a group out there of septic inspectors.
I've,
They went to a conference,
Never heard this.
they provided information at a conference last November down at the Mass Health Officers Association. One of them is out of Northborough, and so they have the data out there, and the reason is it's,
Yeah, it might not be a
the-
company here.
it's not
right?
everybody, again,
Yeah.
I'm glad you're asking these questions, because it's not like I'm saying they're all doing it, but there are certain companies that have been found to be in a conflict of interest because they're inspecting the septic systems, and if they fail them to get a replacement job, that's where the conflict is, and that's a big if. I'm not saying here, but that
yeah.
has been presented by, believe it or not, septic inspectors who are concerned about it.
So I don't see that as our job to oversee. I don't know how we would look at septic companies and know that they failed somebody and they really shouldn't have failed them and now they're repairing something like that. They
Well, we
should have
wouldn't-
some board of
yeah.
overseers themselves,
Yeah.
correct?
Well, they don't, and just like with soil testing, they don't. So they have us, and we oversee soil testing for the same reason, and that's engineers. And,
But you're saying
know-
like the engineer, like if they're doing
Oh.
not so good of a job, there's somebody who gives them a license, is what you're
Correct,
saying.
because you have to engineer a system to replace a system or,
yes,
Yeah, but I
So-
think she's saying it's like, let's say a Title V inspector is failing a system purposely, which hopefully not, but purposely. They have somebody who licensed them, and she's saying that they would
State-
oversee, yeah.
the state has an agency that license septic inspectors. They have to get licensed every 3 years. If there's a question on septic inspector that failed a system, you've been through this, and a septic inspector who passed a system, same septic system, they require us to get involved. I'm a septic inspector, I'm a certified septic inspector. I have to be able to verify who's correct.
Well, I think that
So
would,
they rely on us. Unfortunately, the state doesn't have the resources to not rely on the locals, unfortunately, but
But
that's the
it might be a good,
situation.
it might be a good part of our budget justifications for the assistant, because if that's, forget about, fees or anything, but it just, if that's something that's becoming more prevalent now, then it may be something that the assistant would be more critical on it or something, maybe we'll just use that as,
Well, and there's-
oversee.
we do work on it too, because they're required to do historical review. So we spend quite a bit of time with septic inspectors to grab the files, review them, get them the information they need. So a nominal fee would be probably $25 to $50. If we're going out in the field, if we ever go to that route and create a regulation, then that would be obviously the time spent out in the field. It has to be set to the cost to the town, not more, it shouldn't be less, but not more.
So typically, when they come in, do they speak with you, or do they speak with Laura, or
They
somebody
speak
at the
with
counter?
both of us, and they
Both of
pull
you? Why
files.
both of you?
Well, they usually have technical information that comes from me.
So they have to talk to both of you, or they might need you?
They, depending on the septic inspector, they may need groundwater information.
Okay.
Because we're going through this right now with one. Depends on the technical request they have. So groundwater's a big one, where they're
Yes.
trying to determine
well.
groundwater. Oh, I'm sorry, Judy, I just thought of that.
Yeah.
So they're trying to determine groundwater, and they're having difficulty because unfortunately, a septic inspector is not a soil evaluator. A soil evaluator can go out and determine groundwater, but a septic inspector, unfortunately, they haven't been trained to do it. They go with what they can find historically on records.
Okay.
And they'll call me and I'll be part of the process that Laura and I, it's just not pulling files. So normal, even with Laura's time, it's, I would say 25 to
Check
50
something
was a
forward.
Okay.
reasonable.
I wanna see
mean,
the meeting in August.
it's about the whole budget, but these are my thoughts.
but no,
and like Chris said, we'll
I'm
get to
just
the
trying to
details.
understand processes.
Oh, it's good. It's good that.
I'm big on processes, sorry.
No, it's good.
The other question that I have is, we're talking about nurses. I don't know what nurses do for the Board of Health. I know, I'm assuming like the flu clinic?
Well,
Ah.
they used to. We don't have a flu clinic at
Okay.
this time.
And then I'm seeing, I know that you very generously donated the refrigerator for childhood vaccines, but are these vaccines for kids going into school?
Yes,
So why aren't the school nurses doing this?
they will be with us. We're
Well-
the responsible party to gather, and to collect not collect, to receive the vaccine from the state. Health
Okay.
departments do that. But we got commitment from Audrey
Good.
LaCroix, the head nurse. She wrote an email back to a request on what their part will be, and Diane and I have been working on it as well.
Yeah, I was gonna say, that's the next.
With Nancy, it's the next item on the agenda, so we'll go over
okay.
that. But, no, it's okay.
So the nurses, that were on this, there were nurses on the
Public
budget.
nursing services on the
Yeah.
budget.
$10,000?
Yes.
Okay. So what do we need that for?
It provides the 5 hours per week service, but you can see we expended $13,331. The town is responsible for providing the resources through a medical person. It could be a doctor, it can be a nurse, most of them are public health nurses,
Okay.
to do overview of communicable disease cases within your town,
Okay.
as well as provide services of vaccination and so forth. So that's, and public health emergency preparedness that we were talking about, because this,
Yeah, she works
That's-
5 hours a week for us.
Okay.
In
She's only
addition to
here
that,
5.
there's a TB case, she needs to follow through to see whether the person takes the medication or not.
Obviously, just to make sure
That's
there's
a
no
big one,
outbreaks, if
Kate.
there's, the
Thanks.
three of
Some of
us went
those-
to
some of
dinner
those
and we all have a communicable disease, food
Some of
illness.
those-
The whole
Yeah.
Make sure-
restaurant?
Well, right,
Okay.
but she has to
Oh,
keep track of
okay.
that.
But
I
Kate,
just
if
had,
there is a
I don't know.
there's
KG's
a hoarding
bringing out-
case, then you need to get her involved in it,
Oh,
so those things. But we may not get most of the data because there are restrictions on how much data can be shared with us because of
of course.
HIPAA rules
Yeah,
or whatever
sure.
that,
Right.
But I'm things, glad Kate-
privacy issues.
Yeah, I'm glad you
But we
brought
get
up
some-
TB.
Some
Right.
overall
Hours.
numbers, we'll get the number of cases we might get, we added or subtracted, or one went through,
Okay.
those numbers, statistics we can get it, so that would help us to evaluate
Yeah.
how effectively are using the nurses' time.
Yeah.
So that's the only thing, that's why we have been insisting on getting the data up all
Right.
along for past 1 year, we've been
Well,
And unfortunately,
with Mark on that.
our intern, and
Sorry,
that's,
that's-
it's funny you say, if I may, first, very good point. I almost forgot, the TB cases is what usually draw us over, because you have to do medicine adherence 5 out of 7 days a week. That means going there and watching them take their medicine, and it can take up to a half an hour to an hour, because Some of those pills have sulfur in them and they're very hard to swallow, and the nurse has to be there to watch the entire process to make sure they are, so we don't have a TB outbreak in our town. And that takes up, that's why we're overextended, I think, is the TB cases. But just one thing, because KG, you brought up, when we just discovered how difficult it is to work with the information system from the state, the MIS, Mass Information, and I forget the other I system, and it provides us with data on vaccinations on people. It's not accurate. Our intern's doing vaccination promotion, and when she's reviewing information, she asked Nancy to go into it, and her advisor at the Department of Public Health, and they said, unfortunately, the system is still in major need of data. So we're not getting the data we thought we would immediately. So, but we'll get, the state hopefully will get there someday.
Okay.
All right, you wanna read?
I know this isn't relevant, but it seems to, I mean, it's not, it's relevant a little bit, but when I sit there and I hear you say it's difficult for them to swallow some of these pills
Yeah.
for TB, maybe a pill isn't the best form for that medicine. I mean,
They're doing it at home, and that's all they can do. That's what they require.
I mean, can't they?
I
They do
watched
it-
it. I watched it for
gonna say,
an hour once.
I
They're
think
gigantic
They
pills.
do it, well, they also do it more
They have
to
to
make
do
sure
this.
people take their meds,
That's what I
or
mean.
for medical purposes.
Well, I think
because
you're
pe-
saying if the nurse is there, why can't she give them another way?
Oh, right.
No, I know,
mean,
but I'm
an
saying that
injection
they
or
do it to make sure that
transdermal
they
or-
don't skip a dose for our benefit.
That's the whole, yeah.
If
that's
they
the
don't
whole-
take their meds, they
No,
shouldn't
but
be
the
out, right,
bottle.
so I
But
think
even
it's
if the
more
nurse
that
is
than,
there.
I don't think it's physically taking it, it's to make sure they take
I
it.
got you,
It's
yeah.
not,
But it takes time, because physically to take it,
Sorry.
I watched one. And that poor person had to hold her nose, had to take a pill every 10 minutes.
And there are some people that have a hard time taking pills.
And that's
why
why-
you can, there are certain medications that can be dispensed as a
We-
liquid.
right.
And
we
there are
don't-
certain that could be an injection.
I'll leave it for the doctors
And
on
then there are
that.
transdermal patches.
I don't-
I don't know
I don't
if
know
there's
if
other
we've had that
better
problem
pills.
often.
I don't know.
I mean,
but
if
I
we're
know
waiting for an hour for someone to swallow a pill,
Yeah.
there's gotta be a better
Well,
way to
correct.
every
dispense
10
medication.
Chris,
Yeah,
she
not-
had,
not
I
all
watched it, she had
medication
to
is
take
in
7 or
syringes.
8 pills,
Oh,
big
and
ones.
They can't be
oh, believe me, I
transferred.
get it.
Things
I've
that they
seen,
give it through the
my
blood.
mother used to have a hard time taking pills, and she took 20 or 30 pills a day.
But these pills smell too, and I don't know if they make a better
I
pill. to
don't
be
know whether
honest.
they have any injections for those medications.
All right, let's move on
I'm
to
sorry.
Nancy's
Well, every-
Good
checklist.
question.
All right,
Before you run through that, the other idea that I've been promoting is to look at the grease trap forms and fees for it. So
we don't do the inspections though.
we could, because our food inspector goes and looks at the log to see whether the grease trap has been cleaned or not. He's
We could
supposed
install
to.
a grease
The
trap
food
in your
inspector.
kitchen.
Well, I think once we get to the budget, we're gonna review the fee schedule.
Correct. The other thing is that, no, we are giving waivers for everybody. Look, if people want waiver, then they need to apply for a permit to waiver.
I'm gonna charge you to come in front of us.
Anytime,
To
anytime.
raise
You wanna
money,
come
right,
in front of-
Diane?
Yeah.
No, he's saying that, not me.
Yeah.
It's-
Gonna put a grease trap in your electric car.
He's like, you wanna come in front of the board, you have to pay.
Well, we are just keeping log
So-
of who needs a waiver, and we are doing their job, so they need to do their job.
So what I'll do between this meeting and the next is work with Diane and see if we can meet with Framingham on the nursing service. And then,
And maybe assistant health. or maybe
and
we
the
can-
assistant health agent will get the data to you. And
Yeah,
I
well-
wanted to give general ideas of what would be a possibility.
I mean, I'd still like to put these on our budget, you know, to kind
Yeah,
of have
oh,
that
okay.
plan. and
That's
then
why
meet
it's
with-
A or B.
Yeah, and then
Yeah.
Framingham with the same.
Framingham's B,
I mean, if
okay.
we have to back something out, it'd be
Yeah.
either plan, but,
Our own budget is A and then, okay.
well, our own budget is A and B, and Framingham's budget is A and B.
Okay.
Framingham's A and B as
Okay,
well.
okay.
All right, so this is what Nancy put together for us?
Yeah,
This is
oh,
good,
okay,
yeah.
yeah, we're on the next section, which is Nancy's
Sorry, moving right
information, childhood vaccination under D here.
Okay.
It's, so, Nancy put together, she did it as an email. I said, Nancy, put a work plan together, just so the board can look at that. So that's what she has done, and, that's what you're looking at. And
So I
she-
assume this is just a, under number one, the third one, it says, it will be by appointment only or walk-in
Yeah,
clinic
it's a
also.
she should have put a question mark. So she wants to sit down with Audrey LaCroix,
Okay.
she's the head nurse, and decide on how do we wanna handle it, cause that problem is Nancy's she's available by email, but she's not at the office right now, she's out of the school at this point. But that would be, cause I told Nancy, you know, if we decide to have the vaccinations here, we have privacy curtains, they're on stands, like, and we can set those up. If they decide to have them over at the school, we have coolers, cold packs, and ice packs. We could transfer medicine to the school, the vaccines. So those are the things that still are being worked out. Logistics.
Okay.
This is kind of troubling, or is it normal that if they have 34 new students registered already, some have vaccines, but most do not?
I'm glad you pointed that out,
What
because
does
that's
that
what I
mean?
wanted you to see. That means that the majority of them are gonna need to be vaccinated before they're allowed to go into the school system in the town. Or if they give them 30 days, believe it or not, sometimes. And I'll have Audrey explain that. I was a little
Okay.
confused.
I was just gonna say, and if, just a number, like, because they obviously know,
Yeah.
and let's try to be proactive. If we know we have 10 students who are not properly vaccinated, and
Let's
we're
reach out to
assuming they're not, let's reach out to them, go, this is what our plan is,
Yeah.
well, this is the date, like, let's just,
Yeah.
because,
And the school's now hired someone. That's why we have the data so soon. I was surprised. I said, Nancy, how'd you get that number? She
Right,
said,
but
because the school hired someone to.
But she
for
still left
incoming
it vague,
students.
saying that some have vaccinated, but
And
she
that's-
should be able to get some number on that.
She
Yeah.
knows the
and yeah, and she should be able, they should, that
The
person,
school hired not a resource officer, but a resource person who does the intake now of new students, and that's where those numbers are coming
Yeah,
from.
the number 34 is fine, but she said there's some
Yeah, that-
already
she wasn't-
vaccinated, so we need
well,
to
we
know how
need to,
many
I mean, I'm
are.
assuming they'll follow those students to
We'll
see
get a
how it's
hard
going,
number.
or.
Let's not
You need a hard number.
Well,
and
that's what I'm
Yeah,
saying,
we
is
need
just
a
be
hard number for
proactive.
those.
Yep, okay.
If
And
there's
it's
only
gonna
one-
grow, it's
If
gonna
there's only
grow.
one left over, then it's easy to handle. So we
Remember,
let you know how
34
many
in
are.
July, we're not even into August, so that number's gonna grow, but I'll get a hard number on that.
Yeah.
So by saying this and talking about this, I'm assuming that if students aren't vaccinated, that it falls on the Board of Health in some way
Well, this
to
is
make
what,
sure that they are?
well,
It's on the
This is
school.
where,
This
I-
is
this
what-
is where I agreed to disagree as
yeah,
well before.
and this is what happened actually. Last year became an issue because Framingham couldn't afford to help us out anymore. I won't say afford, but felt that we needed to pay
Pay for
them.
our services.
Yes, pay for our services. So, what it created was families from Ashland having to find another place to be vaccinated because we didn't have the vaccine, and you have to set up your refrigeration, your freezer, and be inspected by the state to get the free flu vaccine. But the issue became, we didn't have that because we've never had that. You know, we never did childhood vaccination, but the demand is there now. And Audrey LaCroix insisted that we start looking at it, because with Framingham not doing it, it started to bottleneck with the students trying to
So are
get
these-
into their school. So we had children not going to school based on vaccinations.
So is this because they don't have insurance?
They're underinsured or not insured,
Okay.
correct, or need to be insured. So what we felt is that, you know, the immediate need can be handled, but when you need to get insured, you have to apply, and it can take, I thought Nancy told me, up to 4 weeks to be approved. So these 4 weeks, the students are without school.
So,
You
but
know,
we know right now that some are not, most do not. So I'm assuming the school says, go to your doctor, and they say, well, I don't have a doctor.
That's exactly right.
So there's some great agencies in our town, Kara and
So-
others, that they could go to for help in filling out these forms.
So my original thought, again,
Right?
this is where I kind of agreed to disagree with what was going on with this,
Okay.
is that I do agree that, from people would tell me that it takes a long time to get a physical appointment with your, you know, for your child to get a physical, things like that. But
Right.
when people come here to town and they say, well, we want to enroll our child in school, we have no pediatrician, we have no insurance, they clearly have other issues besides a vaccination. So we need to connect them with that.
Right.
So that's why when we originally talked about is doing it here, because our, I'll call her social worker, sorry Jennifer, social worker works here on Wednesday nights. So at least if they're here, they can meet with her and she could help them through the other parts of the system.
Right, okay.
So this is what I'm hoping comes out of this, is that it's not always at the school, that it's here, because we have other services we can provide them.
Does Jennifer, as the town social worker, go into the schools?
No, they have their own
They do.
person, and her name is,
Problem that I faced confusion is that we are not sending them for any reason to Framingham. They're going on their own, I guess.
Yeah.
Whoever
We're
is going
sending
to
them to the
Framingham.
free clinics, we're sending.
Yeah, but we are not telling them, go there, there's a free
Right.
clinic, or we are
We
not
are.
directing them.
We are, but the problem
Who
is
is
that
directing
the
from
free,
here?
we
Where
will
are
tell
you?
them, we've been telling them for years, you need to, we don't vaccinate. We've been telling them for years, go to not Framingham, but to the Metro West Free Clinic. There was one up in Sudbury, they're not close, and there's one out in Shrewsbury. Problem is, as Diane said too, is sometimes it's just not the resources, of getting in here for a vaccination. It's the transportation too, where that would be helpful with Jennifer to
Well,
help them out.
and I think whether
they may
it's
have
done
no
at, I mean, I guess I
transportation.
should say, if it's done at the school, because we should use their resources as well, because this is taking care of a problem for them as well. As long as they know that they should pass along the information that there's other services, because
I think
we
that's
could
a great
offer.
idea.
Yeah, we
So,
could offer,
but if
'cause
we-
like I said, the school has one as well as we do,
If Jennifer
so.
sits in the town building, how would these people know that they need to contact Jennifer from the school?
So the school department has, again, I apologize for people's titles, but I'll call her a social worker, but she works over at the school as well. It started, I believe, about a year ago. So I'm hopeful that part of this plan, that's why I was looking for something like this on papers, hopefully the plan is that they would work with, you know, the patients and the parents with their school system as well. 'Cause
So
she
there
works
must be
with them,
ways
so.
to make use of her services by connecting them, that's
Yeah.
important. So
Absolutely.
Yeah, that's what I'm talking about, like, if we have, you know, a social worker here and somebody with the same role in the schools, and we're talking about kids in the schools needing other services other than vaccines, maybe the parents need help with some other things. Somebody's gotta connect these people.
Yeah, and I don't-
This is the wrong place for it to fall on, cause we can't help them in that way.
Right. So, I mean, I guess the only thing we can do is when Nancy meets with Audrey LaCroix, find out how she handles that on her end.
Yeah, that would be interesting.
So
Yeah,
we-
maybe if you could just ask Nancy, maybe just.
we also need
As
to,
crazy as it sounds, I almost feel that this should really fall on the school committee.
but-
It's not us, yeah.
I'm counting to 10, because when we
Okay.
started this process, because I wasn't here at the meeting,
Uh-huh.
just for the record, I was against the whole vaccination plan, because we have other things we need a nurse to do, because it was falling all on us.
Right.
Now we're finally gonna meet with, well, I mean, I know she's
Yeah.
been talking about, now we're gonna meet with the school, I'm
Yeah.
like, but this is not just our issue. We can't,
Correct.
they can't get the vaccines, we can, but they're the ones with the issue. We're trying to help the clients, but
Right.
they need to take at least half the responsibility off this
Yeah.
department.
No, I
Yes.
mean, the way I see it,
Which-
our role should be, they give us an order to get a vaccine, we order it from them and give it to them.
yeah, may I also request that any calls or information that comes in as a request for vaccination, they be logged in without the name, but the number of cases that come in,
Absolutely.
that we know, we need to keep track of that data available.
We
So
need to as well. We
If
have to
there's
re-
only one
you
or
have to
two
re-
coming in,
No,
then
but you
that
have
can
to
be
report it
dispensed
back
of
to the
without any
state.
issue.
You have to report it back to the state,
If you use
But
one.
that's, falls on
There is
Laura and
cost-
Mark to make sure they
Yeah.
keep a log of what it is, and when they came at 2:30 today, they just mark it, put a number, 1, 2, 3, whatever that number
She'll
is.
have to report, she has reporting forms she has to utilize for each vaccination, so there's paperwork involved. I'm glad you
This-
brought quite a
we are
bit.
not concerned about the paper, I'm just,
It's the-
No,
if
but
somebody
that's
calls
the
up and says,
reporting.
Mark, I need vaccination, I'm so-and-so, all that you do is look at the time, 2:30, somebody called, how many vaccinations, then you just mark it down. So we have a tabulation available for you, saying,
We
that, okay,
will-
these
we'll
are the
have
work that we need to attend to
Well,
for
and it's,
vaccination.
I'm assuming, I'm making an assumption is with, again, however many people are not vaccinated, we don't have a waiting list. We don't have a list of
No,
people we need
because
to
we
do.
can't offer it yet.
I'd like to offer my assistance, maybe when we sit down and talk to the head nurse, Audrey, and anybody else, and maybe ask the social worker, or whatever the title is at the school, and the social worker here, and actually form like a committee that can like brainstorm and figure out, how can we take care of these kids? We know there's a lot of them now, like what proactive measures can be done, so that the kid doesn't get to the first day of
That's
school and say,
great.
go
Right.
home for 4 weeks.
Yeah.
So,
Yep.
I mean, it's just a simple solution, it's
Right.
putting a little
Yep.
process in place.
Yep.
Yeah.
Yeah, and that's what this was, that's what
That's
this
what
was
this
for,
is.
is because we didn't,
Because
we
we
don't
didn't
have a
have it last
process in
year.
place.
Yeah.
I mean,
Yeah.
it was nice that KG bought the refrigerator, freezer, but we didn't really have a process, so that's what we asked Nancy to
Yeah,
do,
you
is
wanna
put
bring
this so
that
we can
number
look
as
at
low
it.
as
but-
possible. You're never gonna get it to zero,
So,
but.
with that said, do you want to table this discussion?
If I may, though, we can't wait too long, because I have to purchase a refrigerator. You have to get a special pharmaceutical refrigerator, it's around $1,200, And we can't be inspected, you have to be
And you
inspected by.
can't have it without a generator, and this building doesn't have a
We
generator.
worked that out with the, I think it's in here, we worked it out with the Metro West, where is it? Nancy already called, in, View, DPH.
It's in where?
We have a backup for our
Metro's
vaccine.
Medical Center.
Thank you.
But
We
and
already worked that
I'm
out.
just gonna restate it just for my own sake as well as, and I would like it all to be put on hold until we figure out a plan, because if we spend $1,200, well, how do we know we can't
Well,
store it at the school?
what will happen then is, because their refrigerator doesn't meet the code either, it has to be a special, we went through the DPA, Department of Public Health. The refrigerator has to have several things on it. One is an easy one, digital thermometer. It has to have a fan on the top part of the refrigerator, let that cool.
Well, I
So there's not many of those on the market, and so what the issue is Nancy brought it to my attention today. If we wait till August, you still gotta get the state out here to inspect. You're gonna have a backlog, because we won't be approved probably till mid-September. That's the issue, so it's
I know,
timely.
but we don't.
We don't know if we want the
can't get-
responsibility yet.
Well, no, but
Right.
we're not prepared for vaccines now.
Yeah, and,
So,
we already
we
have
don't
an
ha-
emergency, right? The Metro West Medical Center can store them if we need to.
Well,
No,
my
no,
thing
that's
is
if
that,
the power goes out. That's the agreement, that's if the
so,
power goes out.
just playing out the scenario, because
Yeah.
I'm simple math. So the power goes out in this building, nobody's gonna know, except for me, because I'm the closest one here.
Mhm.
So we're not gonna know
Right,
that the power's out here until we get back here on Monday morning.
right.
Defeats the purpose.
Well, this is where we're gonna work out a system where as soon as someone knows, they're to notify someone from our staff.
But why wouldn't we
What if
store it
someone
at a
doesn't-
facility that has a
Because then you
generator?
have to drive every time to go to that facility. I wish well,
But why couldn't we,
I
if
agree
we
with you,
decided
it's
to
easier.
purchase these refrigerators and
Does
use them at the school?
Police department doesn't have a generator that kicks in immediately automatically?
yes, they
You
do in the
couldn't
school.
house the refrigerator there?
Diane was bringing up the schools too,
Well,
they
that's what
do
I'm saying, is
too.
I think we should just a minute,
I
I
don't have a
mean,
problem
and
with that.
have, and just wait to purchase anything else, because if you meet with the school, they might go, absolutely, we'll just stick the 2 refrigerators in the corner, it's gonna have a locked door,
I agree
we'll
with
leave the
you.
vaccines
Yep.
here, because I would say
That's where they're needed.
most of them are gonna be needed there.
Right.
That's a good
And I'm
point.
sure they can add it to their budget
It's,
easily.
well, and if they have,
$5,000.
well, they might, we don't know unless we ask, we
Well,
don't
the other
know.
thing too, I mean,
I mean,
we don't know. It's- They can help us, meet us
They-
halfway.
sure.
We've already
Yeah, you've
bought
already
one.
started the process. You bought one.
Small one.
Mark,
not
your,
me.
your first sentence just exposed the flaw in the system, as soon as somebody finds out. If as soon as somebody finds
We'd
out
have
it's
to
already
have-
too late,
yeah.
it's all
No, it's
moot.
not, they're
You know?
good for 24 hours.
But what if it's more than that? I mean,
Well,
what if it is?
I would hope we get a call that
Well,
says your power's out on Main Street.
I
But they
guess it-
shouldn't be
Yeah, you would
approving
know
us,
immediately,
but
right?
they
No, I
shouldn't be
mean, you
approving
could
us
buy-
to
you
have
could
it
buy
if we
a-
don't have.
You could buy a.
So many things flawed with that thinking, Mark.
Yeah,
Like,
I mean,
So
you
we
have
don't
to
have
buy
a
an-
if your
system.
electricity
No,
goes
we
out
don't have a
Friday
system
night,
that
you don't find
notifies
out
us
till
that there's no
Monday
power here.
sometime.
Oh, I
Yeah.
thought you
Who
had
they
a
gonna
system
call?
on
No.
there that automatically
No,
tells
and
you the
even
power's out.
if we
So
had a
this is
generator
not a
here,
good building then.
even if we had a generator
I thought
here,
we had
it's
a
gonna
system
be
that
for
notified you
like
right away.
the servers or,
There's a way to do it, that you can buy an uninterruptible power supply
Yeah.
that connects to a network,
Yeah.
that will send you a notice when it kicks in.
That's what I
and
thought
if
we
we
had here. We
find,
don't
Yes,
have.
they do.
no, if we
Right.
find
Okay.
out, this school
But
might
again,
This
now
be,
is
you're
not
talking
a good
about
building.
but the
$1,000.
school might be equipped to house the refrigeration
Yeah.
and like,
That's fine.
Yeah.
alright, so
That's an easy
you'll be
one.
willing to
Yep.
work with Mark and get the connection to the school?
So the other
Okay.
thing though is, and it's important, is that we have to have this equipment before the inspection from the Department of Public Health. So with
Yep.
that said, if it is in August when the board makes that decision, then we're into September possibly, cause then we gotta purchase the refrigerator. If it's really a matter of where it's going, that's one thing. If it's a matter of purchasing, that's another.
I think we need a plan.
time-wise.
So, right.
Well, this is the plan. This is the
So I
plan.
think
That's why I had her do
our
it.
backup plan sounds like we could do this, Mark. To make a really good, have a meeting and stand back from it for a minute, not rush to buy a fridge that we don't know where we can put with uninterrupted power yet. But if we need to get vaccines, we have a signed thing saying we have emergency place. Well, if we get vaccines, it's gonna be an emergency, we need to store it there.
Mhm.
You already have a signed thing.
That's
So we
only if
can
we
keep
lose
'em there.
power. They won't let us store them there.
No?
No, that's only if we lose power.
But the school,
So we're better off at the school
I-
if they will allow us to
Okay,
keep
all
our.
right, my
But
thought.
the other thing too, though, realize this, the schools are locked up after a certain time. we have to make sure we get access, and that's where the school nurses can come in handy.
Well,
So,
All right,
I
so
mean,
But
that
these, the
could
thing
work
is
out.
because we're not, we don't have a plan that's inclusive of everything right now.
No,
So,
no, this is the
okay.
work plan that we put together
So if we
up
have
to
to
this
have another
point.
meeting to discuss it, I think we could probably have another meeting to
Absolutely.
discuss it.
Okay, that's
So if
fine.
you,
Yeah.
excuse me, if you
No,
could
go
just
ahead.
try to get together, sooner than later,
Whenever,
and,
Let me know.
Tomorrow or next Tuesday when Nancy's here.
yeah, and talk to Audrey, you need to get in touch with
And
Audrey.
Audrey will have to do by email, she's not available in the summer.
oh, okay.
She's all by email, so
How's
if
she
you-
meeting with the head of the nurses?
when she comes back to the school system.
Oh, yeah, so we're definitely not doing this before, we
Yeah.
can't do this
Yeah.
before, we don't even have a plan.
So
In
to
that-
that, right, to
Robbie
that
first.
point, so forget about it for this year. The
Okay.
likelihood of this happening is next to zero. So we need another plan to get these 34 kids
You're
vaccinated.
reading my
Well,
We
mind.
gotta have
Okay,
the
okay.
health, we gotta
Alright.
have the health nurse say, all right, here's free clinics, I don't care if you have to go to Boston, I don't care, but
So
your kid has
how-
to be vaccinated, or
How
somewhere
about,
in Framingham, or you gotta get a doctor.
right, and how about, I mean, somebody, or I can do it, I don't mind, somebody reach out to that resource person and say, we're aware that this is a concern, we wanna start working on it now for September. What can we do collectively to kinda help with the problem this year, maybe?
That's exactly where I was gonna go.
Yeah,
Ron,
okay,
you
that's
read my
fine.
mind.
All right.
The reality is, because of timing, there's two plans. There's the short-term plan for September and the long-term plan for long-term.
Right.
And I think that, you hit it right on the nose. What, is there an issue, where we have a case of a family where resources are tight in terms of money, where we might have to subsidize funding to
Well, it might-
pay for them to drive to, pay for an Uber or pay for whatever?
Give me the name of the
Let's,
resource person.
let's look at.
Okay,
let's
you'll-
look at
That's
Alright,
why,
so Judy will-
that's why look at the number, if it's small
Absolutely.
numbers,
Yeah,
Yeah.
we could,
probably get the Uber fund
and we
funded.
could
That
possibly,
would help it.
and we could possibly work on different resources if, yeah, we can kind of pull it
Big
together, cause it
minds,
might be
Ron.
a handful.
Okay.
So I will
Been
get,
listening
I
to
will
you.
get
Give
you
me the
that.
name and I'll be in contact
Okay.
tomorrow.
And what
All right.
happened
How's that?
last year, the reason the Uber might be the best idea here for the supplement is they were going to Shrewsbury. What happened was Framingham said no, Framingham Board of Health. The Metro West Health Clinic in Framingham said they didn't have the vaccine. Rely on your local boards of health. But there was a free clinic out in Shrewsbury we were sending them to. So the Uber is probably the answer to resolve
Well, I don't know if we
Right.
wanna get in the transporting
you-
business, but I think even with that is going,
But
when we meet with
that's it.
Framingham,
Let
if
me-
we find out that,
Let me suggest,
Going to the town
if you
of-
have
city
the
of Framingham.
vaccine with us here, whatever vaccine that you get it, currently you're storing it some, right?
He's
Here,
not
or you
getting
But
know?
we
no.
can't, the state won't let us have the vaccine
Anymore.
until we have our refrigerator.
if we only have a handful of people, we can talk to the city of Framingham.
Yep.
What do you want?
Right.
Okay.
I mean, it might be just that simple.
Oh,
They
I
shut us
know.
down and wanted money, and we didn't say, what do you, how much do you want?
Yeah,
So now it's time to say, we have a concern,
Let me,
it's gonna take us a little bit.
Well, we did ask, but
Did they give you a
Sam
figure?
Wong, no, he said I have to talk to the mayor.
Okay.
So it's time.
So
I
we'll
don't
talk
know,
to the
yeah,
mayor.
yeah.
Is it possible that we can do this? Is this a possible scenario? Let's say we identify and there are 5 students. Can we go to a doctor? Can we just call up a doctor and have a private
Well,
contract with a doctor?
uh,
How much will it be
pediatrician.
to?
I think
Pediatrician.
the
right?
easier thing would be to talk to the mayor of Framingham and find out, we have 5 children, can we
Yes.
send them over and what would you like?
Right, well, right,
Okay.
and it might,
That easy?
it's gonna start the conversation about
Yep.
regionalization,
Yep.
and this might be how we start
That's
regionalizing our
right.
nursing
That's a good
services.
point.
does the
Okay.
Nice.
All
Metro
right.
Hospital have any vaccines?
Okay.
No,
They
no.
don't
The
have
childhood
it.
vaccines are unique versus regular vaccines, so, but I like the idea of the starting process
Yeah,
at
it's
least.
good.
We were working towards this, but indeed, that's why I
And
haven't
I
bought
think
the
she did a great job,
refrigerator,
yeah.
and thank you for the freezer. We may need that, we have
Absolutely.
shingles vaccines that needed to be frozen, so that won't go to waste.
The joy of
But we'll hold off on everything until we talk and Judy, and we'll get there.
All right,
Thank you.
moving right along.
That was D.
All right,
We
and
took care
B-
of that. Budget, we took care of. The Boston Athletic Association,
So,
go
I
ahead.
was gonna say, I think I asked you to put this on the agenda, to
Yeah.
talk about maybe going for a BAA grant. And, I did take the CPR and first aid class that the fire department offers, and, they have a good system running now. So I'm talking to them about, if they wanted to add additional ones, cause all of them are, that, maybe we'll be able to do that, so. I'll have to get back to the board on that in
On
the
the
future.
BA grant one?
Yeah, I'm
Yeah,
not too sure
but-
if it's needed, but,
I also want Mark or Laura to follow on how many restaurants have complied with what is required for anti-choke trained
choke
staff.
saver?
So if there are any more left over, remind them that they're supposed to
Well, Tom,
comply with it.
the
Just
food
make a list.
inspector does check when he inspects.
Right, but you've,
But that research, I think you had a,
Does he have anybody?
correct, but that was a
violation?
limited research that I had, but that's good enough to follow through the ones that have failed, the number there. Remind them they're supposed to comply with it. And then I can go back again, look at all the remaining ones and then find out whether
well,
they have
Tom's
complied with it.
doing that, but we'll make sure, what more do you want?
Tom is now going to be doing all of it, so you got to look
Can't
at
do it
the.
all in one week.
That's right, that you
that's
need to
what
look
you're
at through
saying.
the applications here, which you have the data
So
here.
he can always just report back, it doesn't even have to be,
Yeah.
he can always just report back on a weekly basis, is everybody in compliance with choke saver? Yes, great.
No, those who he has done, he has to list
Right.
it and say compliant.
Right.
But does he have the
Yes, he
numbers
did.
there with him?
Just find out if he's having
He
any
may
issues.
find a certificate there that's not enough, but he needs to have the number saying how many hours they're open, how many hours the
Oh, you're
certificate
talking
there.
about,
That
I
is
know what
what's
you're talking about.
important.
You're talking about
If
the
the establishment
hours
is open for 80 hours and they have only one 40-hour
Yeah, you're
working, the
talking about
remaining
the-
40 hours, what do you do?
Persons.
And the choke is not there? So that is what you need to compare. The Tom is not comparing that, he's only looks at the certificate and says there is
To
a
see
guy.
if it's
That's
there.
it.
Okay,
I
yep,
see what you're saying,
yep.
versus the hours.
Remember you mentioned that before
I
as
need
well.
the number of hours opening to match the number of hours of anti-choke
So
person.
you're looking at the hours of operation, how many people they have.
Correct.
The hours of operation, we probably can easily get. The persons, if it's just one certificate he checked off, we have to make sure there's enough certificates for
That's what he- yeah.
the hours.
That's
Yep.
only from your data that we collected.
Yeah. So we'll look at that data and what's going on presently.
Correct. And then whatever training that we're gonna give.
Maybe we'll have him put down the hours, find a spot on that report to put the hours of operation.
Yeah, I
Total
printed it,
per
I
week.
did not.
That
Yep.
I think I'm gonna ask him to start doing.
For this meeting, but that's.
KG is
Yeah.
you
Okay.
want somebody, if an establishment is open, an anti-charge person on, on the premises at all times, is that,
That's what is required by law.
that's what's required?
And then that's how I collected
Yeah.
some of the data and I identified a couple of them. So I don't know
Where-
whether they complied with
Where
it or
you
not.
see problems is with these, some of these larger facilities such as Papagenos, for example, who are not here anymore.
Yeah.
They would be transferring out people and keeping up with it was always difficult. So, and that's what we wanna make sure is that you got mom and pops and unfortunately, they work very hard hours. It's unfortunate for them.
Yeah.
And they're there most of the time. So if you got 25 or more seats in a food establishment, you have to have a choke saver person there when they're open to the consumer at all times of that operational time period. The mom and pops are usually pretty good. It's the larger monopolies that transfer employees all the time.
All right, let's see if we can get done in 10 minutes.
Oh,
I wanna stick to our 2-hour.
So, did we ever get through your choke saver thing, Diane?
Yeah, I'm gonna look at, right now, I don't know if there's a need, but I'm working on it,
Okay.
so that's all I have to report.
And then on Stop the Bleed, we have kits that we can put up on next to our AEDs, and it was passed by our police officer, who was a nurse, as well as our fire chief. And they thought that was a good idea, but management does wanna see if we can get the staff here trained. Why have these boxes up in the library, town hall, wherever they may be, and not have trained staff? So I've reached out to a nurse who trained me, and this morning I sent out an email to the nurse at the police station as well as the fire department chief and assistant chief, and asked them, the captain, and asked them to consider any of their staff to be trained at a medical. You can't be trained unless you're a medical, you have a medical background, EMTs, nurses, doctors. So then you can be trained, then you can train the others,
I don't know
so.
if Bob Gemma would be able to come in and do that.
Yeah, he has to be trained first by Stop the Bleed, then he can do it,
Okay,
yeah.
No, I just
So-
didn't know, cause
so
he
I'm
does that,
waiting
he does all
for-
the classes for the
So hopefully they'll
fire
pass it
department,
by,
yeah, okay.
that would be perfect, to
Yeah, 'cause
have
then he
someone
can
that's
come in
already
and do it,
doing,
yeah.
training,
Okay.
you know, so, but
Something
the
else to
chief's
work
on
on, right?
vacation, I think. And, so I'm waiting, probably in the next meeting, I'll be able to update the board on that, cause, you know, it's another, same as CPR.
Yeah, and we'll just move
Yeah,
that
that's a
stuff
good
down
idea.
for, yeah.
Mark, what's in a kit?
Basically a tourniquet,
Okay.
and then, a ink marker, so you can write the time you turn the tourniquet
Okay.
into its final position. Gauze and what do they call it, expandable gauze, as well as gloves, first thing you
yeah.
want to put on. And that's pretty much the major, scissors,
Sure.
and that's an instruction card.
Mhm.
So that way, if you
Okay.
didn't know, you could pull the card. And I was going to bring a kit, and I forgot to. I have. At the end of the
Yeah,
meeting,
no, it
I'll show you.
sounds
Styptic pencil.
Yeah.
Then Laura will have to keep that kit with the minutes for the rest of eternity.
Yeah.
But yeah, that's pretty simple.
Pretty basic,
Yeah. That's it for that.
We did the vaccine work plan. All right, everybody get a chance to review the June 18th minutes? Everybody all set with them?
Mm-hmm.
Set.
Take a
I
motion?
make a motion that we approve the minutes as presented for the June 18th, 2019 Board of Health meeting.
I'll second that.
All in favor?
Aye.
Okay, and then, Chris just mentioned, because it's lengthy, we all got an email from Lisa Mead about,
Hemp and CBD advisory.
so, we'll just put it on, so everybody get a chance to get a look at it, just go over it next meeting. Put it on the agenda.
Do we want to do the fees then too with the budget? You want to add fees?
No, why don't we wait, let's get through the
Okay.
budget first, cause I think it's gonna be a little overwhelming, but we'll, we could at least let management know we're reviewing them maybe after the budget submittal or something.
I can do a review at the next meeting of what discussions I had with the resource person and the school nurse, et
Okay,
cetera.
yep, and then, we're gonna review the Warren School report. I explained to Judy that I reached out to, Jim Adams to see if he could either attend or give us some updates. He was away at training, just came back this week, so I did not hear back from him, so I will follow up with him to see if he wants to come to our next meeting or give us an update for the next meeting, so we'll leave that on the agenda for the next meeting.
Okay.
And then the budget preparation. Anybody have anything else that?
Just want to say that on August 12th, the Conservation Commission is going to hear the Eversource gas pipe transmission line hearing, so anybody is interested, they should come and attend and learn through it. And I also sent an email to the board regarding
Gas line?
chemical
The gas.
reform that they had, that apparently it's below the standard levels that the EPA has. What legacy farms, there was some water came through from one of those breaches there I've sent, that asked them to test the soils to make sure there was no chemicals brought in from that side to this side. I mean, there seems to be some level which is way below the warning sign, so that's fine.
Did
That's
you
what
wanna
it
give
is.
an update on that for next meeting? Is that
That's
what-
already given to
Okay,
you, that's already sent it to you all.
Okay, but I didn't know if you were looking to talk about it at a.
Yeah, that's all.
Okay.
Yeah.
We'll have a draft of it.
Yep, I was gonna say, obviously, we're gonna have the tobacco regulations. I think that's it, right, for the next meeting?
I think so.
All right, so.
Anything else comes, we can always send it to you and
Yep.
then we can have that.
Yep, so the next meeting is August 13th at 6 PM here in the Board of Selectmen's room.
Are we trying to do anything earlier, potentially, if the vaccine thing works out, or no? I mean, I can come if we need one, if you determine. And
You
the
know,
rest of
I mean,
the
it would be
board.
great if we came up with a quick plan. I mean, that would be great, depending on, I mean, and maybe, yeah, I mean,
I mean, if everybody's
keep our
gonna be
hopes up.
around, we can at least talk about it
Absolutely.
and maybe get the ball rolling a little bit more.
yeah, I wouldn't mind having another meeting if that was,
If
you know,
that, I mean, if that's.
if we put together,
That's
yeah,
the only thing on the agenda, right, we could just talk about that and.
yeah, so
How
we'll,
many hours in advance do we need to know?
48.
Okay, so let me see what I can find out the next 2 days.
Numbers are critical, so find out how many
Yep,
need.
I
That's
understand.
Yeah,
important.
I mean, even if
Yeah,
it,
but it wouldn't be till the beginning of August anyway, right, first and third, or are you calling it
I mean,
another
if
meeting
we
at any point?
get information that we can run on that, we could have
Have
one.
it anytime.
Yeah, we could just,
Okay.
I'll pull the
Fine.
board together and see if they could meet
Yeah.
any night
Don't
and,
kill yourself over it,
No, it's important, I mean,
yeah, I mean, it's,
as long as the resource person doesn't have the summer off.
I don't believe so.
Okay.
And, even that is, we could,
think so.
I mean, we could always, I mean,
I think she's.
Audrey, I mean, we could see if
Okay.
Audrey can come to a meeting, and we can try to.
Yep.
As well as Framingham, so we'll see what same thing, work both of them and see what we can get pulled
Okay.
together.
And the only other potential additional thing with the budget, and not that it has to be next time. Who was the nice young woman from HR that said she would help us?
Lisa, we call her,
Uh,
Ugolario.
Okay, Lisa Yu, you know, she said she'd be happy to come and help us kind of try to make the story, you know, from an HR perspective, you know,
Right.
this is kind of how you have to do it. It could be too early in the process. Maybe we have to get some background and then say, how do we put this all together, but,
Yeah, no, I agree,
or,
yeah.
no, I just, you know, I don't wanna bother her summer
No, and
either,
if-
but any direction, any
happy
more
to.
direction that we can get.
Yeah, and maybe
Plan
maybe at the
things.
next meeting, we can, you know, even with the budget preparation, we can find out where we're at then and see, you know, maybe the same thing, we could have maybe an off-camera working session with her to see if we can come up with some creative ideas. Is everybody else all set?
All set?
Motion to adjourn?
Adjourn.
Perfect.
Second?
Right.
Second.
Second.
All those in favor? Aye.
Aye.